die sombranzaten maak. Et zu ita saluda, antes di niga, radzaudzan malak estrezas, durante todo em a nogi distância, como cupugi palu, zaniman malak guafi, ikonum nasugi airi, prebatu la noci, nai banderata gaigi, pues atan fani bandera, kau esta pagua pumalapa, giluk tanu man libri, sentamiti man ko badi.
Fanogi tamoru purita nota, kantai matu nanyagi todu ilugat. Para i honra, para i gloria, abiba is la sin para. Para y honra, para y gloria, abiba is la sin para. Todo y tiempo y paz para kita, dan gini langit na bendición. Conchay peligro na fan sofuham, Zeus protegis languahon. Conchay peligro na fan sofuham, Zeus protegis languahon.
Osaina, Oaniti, Ninumari, Amines, Kuntan, Ninale. Osaina, Oaniti, Ninumari, Amines, Kuntan, Ninale.
just got the news today. Things will never be the same. Things will never be the way it was just the other day. They told me it'd take my life without even a chance to try. I'm not even gonna question why. I just know it's my time to fight. We'll never give up, never stay down. Stand back up, put your feet on the ground. We all know we must fight to survive. So live life alive, it's alright. Never give up, never stay down. Stand back up, put your feet on the ground. We all know we must fight to survive. So live life alive, it's alright now. She just got the news today. They told her she had only days, but she don't really feel that way. She just tucks her head and prays. They told her it'd take a life. Imagine how she felt inside. Though she didn't even question why, she just knew it was time to fight. We'll never give up, never stay down. Stand back up, put your feet on the ground. We all know we must fight to survive. So live life alive, it's alright. Never give up, never stay down. Stand back up, put your feet on the ground. We all know we must fight to survive. So live life alive, it's alright now. You can make it if you try. Don't give up, keep up the fight. Cause we can make it if we try. Never give up, keep up the fight. Never give up now. We'll never give up, never stay down. Stand back up, put your feet on the ground. We all know we must fight to survive. So live life alive, it's alright. Never give up, never stay down. Stand back up, put your feet on the ground. We all know we must fight to survive. So live life alive, it's alright now. So live life alive, it's alright now. So live life alive, it's alright.
All right, let's go. Good morning, Guam. Viva Betness Friday. P-Core fun. P-Core fun.
Woohoo.
Good morning. Good morning, Sabrina.
Good morning, everybody. Good morning, Spanaway, Washington, to Clarissa Uganangauta.
Good morning to Angel and Pete Quintanilla, Castro, coming through Route 10, Chalampago.
Good morning, Christina Hokug from Manila.
Good morning, Umatic, where you might get tested for COVID tomorrow if you're not out getting a tattoo or going to the beach or having a barbecue with 5 people.
Good morning to our friend Carmensita, saying hello and half a day from EPAL.
Fide Marcy Flores, watching from Cañada Barragata.
Hey!
You know, when I first moved to Guam, I was like, there's Canada here?
Oh, wow, there's a Canada. See what it is a long time ago, someone came from Canada.
Yeah,
They moved to that part of Barragata, and ever since they call it Canada.
I guess so.
Yeah. Hey, good morning to Pago Bay, Jotnia. Let's go back down around the south. Ipan, Talafolfu, Windward Hills, Baza Gardens, Cross Island Road, Malolo, Inalahan, Molesu, Umatic, Agate.
We
Santa Rita.
got a first-time shout-out from Tennessee, so Junior Santos is sending half a day love all the way from the Volunteer State.
Hello, Luz Leonis from San Antonio, Texas.
Let's see who else we got here. Hey, good morning, guys. Elsie Ray just writes, good morning, team, and good morning, Guam. You all stay safe from Tamuning. Joseph Castro, good morning, Guam. Coming all the way from East Quetu Avenue, Mugfog. Mugfog!
Jane Sasai is saying Hafaday from New Hampshire.
How about Shannon Mendoza? Good morning from Copperas Cove, Texas.
Hello, Sheralynn Mendiola from Oahu, Hawaii.
Nice. Vero Beach, Florida is saying hello just from Guam guy. You know that's cool. That's a great handle.
Crispin DeLeon Guerrero, good morning from Saipan.
We see you, Carmensita from Ipow.
Hafaday and good morning. If you live in a place that has a overpass.
Norma H.M. Shackley, half a day from Florida. If you live near somewhere that has an nobody lives by the overpass, Jay.
Yeah, if you're on Bellow Road.
Okay,
Which is basically Bellow Road.
Right, okay.
Well,
so-
no, okay. Technically, there's another off ramp on Guam. You know, like when you go around, you come up like you're on Marine Drive and you turn where Nissan used to be. You know, Auto City.
Yeah,
and
see,
then you're going up.
Frank
to,
Blas Jr. writes, good morning, Guam. Just us in Harmon Industrial Park.
Oh, nice.
Good morning, yeah. Patrick Ann Attilig also. Todd's at Hanum here in Kenyatta Barragana. We'll find out what's up with the water. Therese Angoko Herrera. Good morning from Japan. Bossman, Friday, woohoo!
Hey.
Luz Leona's coming to us from San Antonio, Texas.
Also, Debbie Davis, Bardstown, Kentucky in the house.
You know what? In the NBA Finals, there are a lot of Kentucky players, a lot of former Wildcats playing in the NBA Championship. So nice.
Noel Timing Low, accident, Pacific Bank, Tamuning, Drive Safe, Guam, AngelPete, Quintanilla, Castro, Chris. Don't forget Charlie Brown, Irene. Again, half a day from Copperas Cove, Texas. We also have Josh Champaco Mendiola. A shout out to Clara Fetty, Finnet Denny, and Spanaway, Washington. Yes, you're right, Jay. Crystal Duenas chimes in on our Facebook Live. Good morning from Bellow Road.
There you go.
Well, good morning to my family, of course, in Vegas and San Diego.
Half a day from Fort Bragg, North Carolina. That's Tony Kitsutsu checking in. Gene Camacho.
Oh, Fort Bragg. That's
Buena
where the
from-
airborne trains, paratroopers.
Piga Machanao. Connie May Santos, thanks for watching. Linda Marie Perez, shout out from the Boondocks in Dedido.
Where's that?
It's in the jungle.
Ah.
Boondocks Boulevard.
There are a lot of boondocks in Dedido, and they are awesome. Great places to go hiking or just hang out when you're a kid.
Shout out to everybody who lives near a Boondocks that's under the side of an overpass.
Hey, you know what? Shout out and good morning and half a day to you if you have a fence around your house.
Oh, gosh.
Extra bonus points if you actually erected that fence yourself.
Good morning to you if you have a fence around your mind.
Hello, everybody in Quarantine Hotel.
Whoa!
To our frontliners. Thank you for everything you guys do.
Yes.
We got Nicole Aquino, Las Vegas in the house. Half a day. Edward Tyron, half a day from Fort Hood, Texas. See you in the hood.
Half a day shout out to every teacher who is teaching online. Keep it up. You guys are doing a great job.
No, stop it. Don't keep it up. Take the day off. Kids it's too much homework. Relax, okay? It's P-Core fun. Michael Monessa, Nauta, half a day from Talafofo.
All right. Half a day, everybody. Thank you so much for logging on and listening.
Andrew Untalan coming to us from the capital of the state of California, Sacramento. Sacktown is here.
There you go. Sacramento, 621. This is the link. Good morning. My name is Chris. Sabrina. Salas Mantonati. We have Joe Sir back behind doing all the things with the knobs and the stuff I'm not allowed to touch. Jason Salas also pops in time to time. He's our tangent guy. Josh Pangolina writes, scrub your fat, Chris, every morning with the Japanese washcloth.
Ooh.
Yep, I like it rough. Ed Tyron, retired from Fort Hood, brother. AngelPete, I just love this station. Thank you so much. Eldon Jaka, Hafaday, people of Guam. Greetings to the beautiful Adolfo family in Dedido from your neighbors in Cebu, Philippines. Tino, I can't pronounce that last name. Good morning from Mount Santa Rosa, Jigo. Mary Jane Villagomez, good morning to our KUAM family. And Nick Marlene Legaspi, Hafaday from Aston Park Memorial.
Nice.
Well, they're walking, huh?
Yeah, doing their laps.
Nice and
Yep.
early.
Well, let me just tell you, we've got a big show for you guys this morning. We couldn't even fit it in the door, is how big this show is. We had to get an exemption for construction. Oh, wait, they're allowing construction. Yeah, they're allowing everything. So we had to knock out a wall to get this show into the studio this morning, okay? That's going to be big. There's some announcements that came out Late
Yeah, late last
night. While you were almost going to sleep, it's governing by executive disorder. Man, I don't even know where. So, yeah, there's a lot of things that's opening this weekend, okay? Also, Odie Duane's, good morning, team. It's Jeff Duaneus. Christopher, good morning. Morning, Cook. Anita McHale, love you guys. Thank you so much. Canada. This is the real Canada, Bree, I'm assuming.
Okay.
Yeah. Tom Limtiaco says, half a day from Canada.
Canada, our home and native land.
Like I said, it's our tangent guy.
Hey, we the North, all right? Last year's NBA champions.
Yeah. That's all I forgot for Canada.
Half a day.
Yeah, so it's 6:22. The link, here's who's coming up on the show this morning. It's a lot. There's people coming, and they're going to say words. Dr. Peter Lombard. Not really looking forward to talking to him this morning. I love the guy. He's great, but every time he comes on, he makes these predictions, and they end up coming true. Last time we had him on was 2 Fridays ago, and he predicted we would have 9 deaths in the next week, and he was more than right. So when I called him last Friday, I said, hey, come on the show. And he's like, oh, but can I try next Friday? And I was actually like, yeah, let's do next Friday.
Give it a break.
Yeah, and then we got Polly Mike. You guys going to go to church this weekend? I don't know what I'm going to do tomorrow. I was thinking. It's tough because I'm going to wake up. I'll probably wake up and then maybe go get a tattoo. And then maybe take the dog to get a skin tight fade. And then we're going to go get our nails done. And then after that, we're going to line up at Ross. Then we're going to go grab a workout at the gym. And then after that, we're going to go to Mass. And then probably have a barbecue with 5 people at the beach.
Your schedule's set.
I'm
ready
pretty.
to go.
Thank you for giving us something to do this weekend. Oh, wait, there's a COVID out there. Oh, but that's okay, because if you catch COVID and die, you're covered. You get 10 grand. Your family is covered. The funeral's taken care of. But the catch is they don't know where the money's going to come from. They're going to take it from the revolving recycling fund. Yeah, they're going to do a whole bill in the middle of the night. It's going to be Amanda Shelton, and she was going to, you know what? Why 10 grand? We're going to give you 50 grand if you die. People are going to be trying to get COVID now. People who can't apply for the PUA and the F-Bug, they're going to be out here like, touch my face. Don't sanitize. Yeah, so let's just get the show started.
You sure?
I don't know.
Are you sure?
I feel like we already got it started. I feel like we're just getting started.
Hey, we're done. We're done.
Yeah, so 624, the link again, proudly brought to you by Cabo Enterprises, IT&E, and the Thrive Coalition, where this morning you guys are going to get a sneak peek of the brand new One Micronesia podcast with Victorious Falan, where in this episode, we're going to give you a sneak peek. The theme is unity, as our Victorious Falan is going to sit down with Jackie Murati, Senior VP and Chief Communications Officer for Bank of Guam, and talk about how the company has played a big role in bringing the Micronesian islands together. Yes. Also on the way, we'll get Polly Mike about the mass. We have public health coming in. Annette Uggan, the contact trace investigative lead person, and Dr. Ann Pobutsky, who's the territorial epidemiologist. And then we got Dr. Hoa from the Physicians Advisory Group. I was talking with him last night. He texted me, and he was telling me that we're seeing more positive cases, which we are. And we'll find out more about that coming up. And we'll also I'll just get back into it after the news. Just going to the news now. It's 6:25, Friday. It's the second day of October already with the very latest from the KUAM News team. Good morning, Sabrina Salas-Mantanani.
Half a day, everybody. Starting this weekend, more businesses will be allowed to reopen under Guam's current P Core 1 designation, according to a new executive order signed late last night by the governor, effective tomorrow, 8 o'clock in the morning. Social gatherings and congregations of no more than 5 people will be allowed. Religious services can resume, but at 25% occupancy. All Gov Guam parks, beaches, and pools will reopen, but limited again to 5 people per group. Gyms, fitness centers, and dance studios are allowed to reopen, but at no more than 25% capacity. On Monday, October 5th, eligible child care centers will be allowed to reopen, and sports organizations may request authorization to conduct non-contact training at their designated training facilities. As for the latest numbers out of the Joint Information Center, out of 434 samples ran through various labs, 62 returned positive. That brings Guam's total COVID case count to 2,556. 50. There are 635 individuals who are actively fighting the infection in isolation, and more than 1,800 who have recovered. There have been 49 deaths. As of late last night, there were 27 hospitalizations at GMH, with 10 people receiving ICU level of care. Meanwhile, according to the JIC, 2 more Guam Department of Education employees tested positive for COVID-19 on Thursday. One case was identified at DL Perez Elementary School, and the other was identified at Estumbo Middle School. Both cases were identified through contact tracing efforts. We've also learned that the Port Authority of Guam has also reported 2 new cases. The Health Committee conducted another oversight hearing of the Department of Public Health, focusing on the status of COVID-19 investigations and contact tracing. Chairperson Senator Therese Terlahi questioned epidemiologist Dr. Ann Pabutsky about a lack of specific data available to the public, who she responded they'll try to put more detail into their weekly report, including the type of community contact. Dr. Pabutsky adding, data migration should take another 2 weeks, and a new situation report format could be in another month. Meanwhile, Senator James Moylan asked about the possibility of tapping other GovGuam employees to assist public health with contact tracing. Here's more from that oversight hearing.
We've been in PCOR 1 about 7. Now we've been in PCOR 1 about seven weeks or so, and many of our government employees are at home and not able to telework, right? And I'm just wondering, of these possibly thousands of government employees who are still being paid, if we can have them also trained as contact tracers, and if we can possibly increase by 50 or 100 of our contact tracers, I'm supposing this will be helpful for Department of Public Health in improving our numbers of 63% of the EPI links to make it even higher. And if you can explain, Annette, how if this is possible or this will be recommended. And I know we had a brief conversation about, well, we need secure computers, we need telephones for them to use, and they have to be working out of a facility that just not be working out of home. And I think we can come to an answer on that, on how we can improve that. So Annette, please, can we get some more contact tracers from possibly these government of Guam workers that are at home and not able to telework or go to their office?
Thank you, Senator Moylan. Yes, and I appreciate the call earlier. Yes, we definitely would love to have more contact tracers throughout the government agencies. We've been fortunate that we've had DYA, but they've been physically located with us. And due to our situation last November, our department spread out over 4 to 5 different facilities on island. And so my team actually is spread out over 4 locations, from Del Public Health, Grand Care, Castro Mall here in Manila, and then now in Terlahi building in Agana. And again, it's our contact tracers need to have a computer that's on the government network, a phone, so they can conduct interviews. One of our workarounds is to get additional cell phones so that people see a local phone number that's calling them. We do have people questioning, well, why is it a cell number, not a government landline? So we do have people call us back, and we will verify that, we are public health, because they're very concerned about confidentiality and their privacy. And so that actually leads to the issue of, you have a lot of people that can telework at home. However, because the information we're dealing with is HIPAA covered, is a lot of personal health information. We are unable to utilize government employees who are at home because we don't know their security measures at home in regards to their network. Also, where's that computer and the phone in their household, and is there people passing by or in the same room? And so that would avoid the confidentiality and privacy that we need to maintain for our cases and our contacts. I know with leadership, we're looking at trying to obtain additional facilities and logistics. So again, that would be an opportunity as we bring on more staff through our grants and the CDC Foundation, or as you say, having other people who've been trained up and to utilize them, like through the UOG, UC San Francisco training, that we have adequate spacing for them and the desk, computer, and a phone to do the needed work. With the UOG pilot test, this will actually help kind of lead the way in that UOG is stepping up and providing us their own facility. The pilot team will be working out of UOG. They are providing the computers and the phones. And so that's something that we can definitely, are grateful for their support. In regards to having other contact tracers trained up in the agencies, similar to what we're doing with Port Authority, GPA, and GMH and DOE, is have these individuals be our liaison or point of contacts at their respective agencies. It'll help take the load off our team of eliciting those contacts, getting were you at work or not, are you at the same time, same building or location, and so that will help ease the load on our team. But having that communication and collaboration, getting the necessary information so then we can do the investigation and interview and then schedule for the testing. So yes, sir, that definitely is a great opportunity that we look forward to expanding on.
Thank you, Annette. And I'll plan to have more conversation with the director, and possibly the governor can assist us with maybe additional CARES money.
Hearing over public health yesterday afternoon. And with more news, here is Peter Santos.
Hafide, good morning, everybody. My name is Peter Santos with your headlines here on The Link. The COVID pandemic has underscored Guam's severe shortage of nurses. A bill has been introduced to join the National Nursing Licensure Program that would allow member nurses from other jurisdictions to use their licenses here and augment the understaffing at our local hospitals.
The measure introduced by Senator Mary Torres and Speaker Tina Barnes allows Guam to adopt the Nursing Licensure Compact, already adopted by 34 states. Under the NLC, nurses from those states can use their license in any of the other member jurisdictions. GRMC Chief Nursing Officer Jennifer Cruz, who supports the bill, offers this analogy.
We all have a driver's license, hopefully not expired. Your Guam driver's license allows you to drive in any state. This same process can be applied to our nurse licensure laws, allowing a nurse that is licensed in the Nurse Compact law state to be qualified to be licensed in Guam.
GMH CEO and registered nurse Lillian Posada says the bill would also make it easier for active duty and dependent nurses stationed here to work at the civilian hospitals.
Many military nurses are discouraged right now because of this, current process that we have for these nurses to get a license.
But there's another issue that hurts recruitment. GovGuam nursing salaries are still below the national average, and the hospitals often lose RNs to better pay and better hours.
We lost 20 RNs throughout this period, 20 registered nurses, just within this time frame of 6-7 months. And so therefore it is imperative that we really address and adjust the current salary structure for nurses, because then if we don't, for sure more nurses are gonna leave because of this NLC.
Compact members have access to a shared database of nurses' work and disciplinary history, which can be reviewed as part of the recruitment process. For Guam's News Network, I'm Nestor Lecanto.
Today marks the start of fiscal year 2021 for the government of Guam. It'll be the first full year under the COVID pandemic, and money is expected to be very tight. Department of Administration Director Edward Burns says that they'll have to be careful with the cash flow.
As everybody expects, 2021 is going to be difficult in many respects because we're not expecting an immediate return, even if everything were opened up tomorrow. We're not expecting immediate return of tourists. And the economy is highly dependent on tourists. So I'm sure we're going to be careful how we measure out our cash.
Without much of a tourism industry, the consensus is Guam will have to rely very heavily on continued help from Washington.
Certainly hope that we can have a continued access to federal assistance, and particular in the healthcare area. We want obviously Medicaid match to be maximized, and we want to make sure that the community centers are fully funded. So all this money we certainly hope comes in.
In a press conference yesterday, Congressman Michael St. Nicholas provided the latest details on federal assistance. The coronavirus relief bill offered by House Democrats, he says, includes a $1.17 billion allocation for GovGuam operations.
Budget of the government of Guam for FY 2021 came out at $950 million. So this $1.17 billion can fully replace and add extra to the government of Guam budget.
So he suggests Gov Guam could then give a full tax holiday to local businesses by reducing the 5% business privilege tax to 0.
On top of that, I mean, we can even create income tax rebates, particularly if those rebates are going to be going to individuals that can demonstrate that they've had negative economic impacts. We just got to build out the criteria. This is where the government of Guam is going to have to really do a lot of legwork, but it's just part of the process and sign of the times.
In total, Guam could be in line for up to $3 billion in federal help, he says, but the House still has to pass the bill, and it must then also clear the Senate, then the White House. For Guam's News Network, I'm Nestor Lecanto.
Marine Corps Base Camp Blas has officially been activated on Thursday. A small ceremony was held to commemorate the activation of its initial operations. Camp Blas is named in honor of the late Guam Congressman and Brigadier General Ben Blas. The Marine Corps Base will be home to about 5,000 Marines from the 3rd Marine Expeditionary Force in Okinawa, Japan. This marks the first time a Marine Corps base has been activated in almost 70 years. A more formal activation ceremony will be held in the spring. That's the news for now. We'll see you all at 6 tonight on Primetime.
Highway Patrol is investigating a fatal crash that occurred yesterday afternoon along the road leading to Marbo Cave. According to GPD, a wastewater pump truck ran off the roadway and overturned. A 21-year-old male passenger was ejected and pinned was pinned under the truck. He was later transported to the hospital where he was pronounced dead by attending physicians. The driver was also transported to the hospital for treatment and care. No word on the cause of the crash. In national news, President Trump heads to Bedminster, New Jersey for a closed-door fundraiser at his golf property, while his Democratic rivals Joe Biden and Kamala Harris attend virtual fundraisers, and Vice President Pence heads to Iowa in person. Natalie Brand has the latest.
At a rally in Minnesota last night, President Trump touted his debate performance against Democratic rival Joe Biden.
You know, Biden lost badly when his supporters are saying he should cancel the rest of the debates.
But the president is dealing with the fallout after controversial comments he made when asked to denounce white supremacy Tuesday night.
Would you like me to condemn
Proud Boys and right
Proud Boys? Stand back and stand by.
Wednesday, President Trump tried to walk back those comments.
They have to stand down, let law enforcement do their work.
On Capitol Hill, Senate Republicans pressed the president to clarify.
He should have made it very clear that there is no room for people on the far left or the far right when it comes to either Antifa or these white supremacist groups.
Campaigning across Ohio and Pennsylvania, former Vice President Joe Biden said his message to the Proud Boys is cease and desist.
The Proud Boys now have a logo saying, stand down, but stand by. We need to remember who in God's name we are. This is the United States of America.
After Tuesday's chaos, the commission that oversees presidential debates is now considering changes to the rules to try and keep order. CBS News has learned that could include cutting off candidates' microphones. Even members of the president's own party criticized the tone of debate night.
I did not think it was helpful in educating the American people.
I thought it was an embarrassment.
With 33 days until the election, both the president and Biden are focusing on raising money. The president holds a private fundraiser in Bedminster, New Jersey today, while Democratic nominee Joe Biden will fundraise virtually. On Friday, Biden heads to the key battleground state of Michigan, while the president has a trip planned to the swing state of Florida. Natalie Brand, CBS News, the White House. Natalie Brand, CBS News, the White House.
The district court has turned aside a challenge to the law banning cockfighting on Guam. The case was brought forward by Guam resident Setfrilan Songen, who wanted to overturn the ban in order to continue cockfighting without any interference. It was in 2018 that an amendment to the Animal Welfare Act of 1966 made the practice illegal. Ultimately, after considering all the filings in the case by Animal Wellness Action, the Center for a Humane Economy and Animal Wellness Foundation, the court rejected the plaintiff's arguments. The court agreed with the District of Puerto Rico's findings that a live bird fighting venture does not fall within any expressive or non-expressive protected conduct under the First Amendment and is not protected speech. The federal law provides up to 5 years in prison and up to a $250,000 fine for any violation of the law. The Jotnia Fire Station now has a decontamination stall and upgrades to existing restrooms and laundry area thanks to the 254th Red Horse Squadron, Guam Homeland Security, National Guard Joint Task Force 671, and the Jotnia Mayor's Office. As you may remember, it was back in June when COVID transport units were established at the Jotnia and Estumbo fire stations. GFD says the renovations provide another level of protection against the spread of COVID-19, adding that personnel can conduct hygiene and decontamination procedures more effectively. And finally, Tito's Handmade Vodka and Island Beverage Distribution will be stepping up to provide more than 400 meals to bartenders and servers in Guam that have been adversely affected by the coronavirus pandemic. Through Tito's Food for Friends program, over 400 meals will be purchased for takeout from select restaurants to benefit employees in the F&B industry this month. Tito's Food for Friends program is being facilitated through Love Tito's, the brand's philanthropic arm on a mission to turn spirits into love and goodness. We're going to have more on the link right after the break.
Stay connected while physically apart.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
Our frontliners have been working tirelessly to keep us safe, and now they need your help to get our island back up and running as safely as possible. Did you know your smartphone can be one of the most powerful tools in our fight against COVID-19? That's why we're bringing you the Guam COVID Alert Exposure Notification app. This app works by letting you know if you've been exposed to someone who's positive. It's completely voluntary, and more importantly, it's completely anonymous. It does not track who you are or your location. Researchers at Oxford University have found that for every 100 to 200 downloads of the app, it can prevent 100 infections and save one life. Add your phone to the COVID fight by going to guamcovidalert.guam.gov or download it from the App Store or Google Play now. Help Guam stop COVID-19.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
You're watching The Link with Chris and Sabrina on TV 11, but don't leave yet because we're coming up next on CBS This Morning.
we breaking it down. Boogie man, our star man, you know we break it down now.
Bring a different mode to our almost words for the praise.
What soul they say?
What a chick be new, then the boys be worse than the beat.
So let be. I wanna ride him like one bomb, roll around.
Rolling up from Daddy Dope. That's right, you can now stroll all around. I mean, you don't have to, though, okay?
Because you're safer at home.
Yeah, this is a hoot.
We're still in P-Core 1.
Don't, Bree, be honest with our listeners, please.
I am. We're in P-Core 1.
Yeah, we are. We had a comment here. Bev, Tess J. Solis. So why are we still in P-Core 1? Doesn't make any sense at all.
Maybe.
The executive order is very malfunction. Hey, keep your comments coming in our Facebook Live feed here. Good morning. It's the link on the breeze, 93.9. The 648, let's go to the KUAM News Zoom room, where I gotta just say, just for clarity, because someone had mentioned it yesterday, one of the guests on the show had mentioned our sanitizing duendes.
Mm-hmm.
For those of you who don't know, duendes they're the little Smurfs of Chamorro folklore, right? But they're not blue, they're brown. And it actually, they're similar tales in a lot of different indigenous cultures, right? The Philippines, what are they called in the Philippines? Duendes. Oh, what? Yeah. So I just got to say, because I always say they go and they sanitize everything, but we don't really have sanitizing duendes, okay? Or do we? It's definitely clean in there, though, right? Dr. Lombard in our KUAM News Zoom room. Dr. Peter Lombard.
Good morning.
Happy Friday.
Happy Friday. Does it smell like Lysol or Clorox in the Zoom room?
My smell, I think, is still okay, but I'm not smelling either right now.
I hope so, because if you can't smell anything, that's one of the symptoms. 648. Of course, we've been bringing on Dr. Lombard back when the show was called Containing COVID, and he's made a hobby out of crunching these COVID stats, Doc. And we last spoke to you a couple Fridays ago. It was a very sobering conversation. You predicted that we would see 9 deaths in the following week. We saw more than that, right? How many did we see, Doc?
I think we saw, boy, it's been like 12, I think. 12 in a week.
Right.
That was, a few more than expected based on the methods that I was using to calculate. Can you hear me okay?
Yeah, we can hear you pretty good. Yeah.
Okay.
Doc, let's just...
So it's we're a little bit ahead of pace of what the infection fatality rate would predict based on the ages of the patients we're getting as positives. I think that's, if you look at the ages of the people that have passed recently, they're actually on the younger side rather than over 60. There's surprisingly high numbers below 60, and I think that's the main reason. That being said, we still are very, very lucky. Our overall fatality rate, I think, is somewhere around 0.1%. And that's about 5 to 6 times less than you would expect. The CDC, the WHO, they're all saying, the numbers up to this point are somewhere around 0.6%, and we're at 0.1% right now. So I think, and that's doing an extrapolation of the total infected, not just the numbers of positives we have, but saying how many more than that were actually probably infected that we didn't know about. That's the number you have to use as your denominator, and then divide deaths into that. So if you use that number, we're about 5 to 6 times less. So even though 40, 50 deaths is certainly very tragic, it could easily be 250 to 300 deaths, and how much more sobering and challenging what things have been for us the past few months if we were at that point already. Now, why we're so lucky in that regards, is it leadership? Is it the fact that we're on an island? Is it we're doing some things right? I think probably the biggest part of it is our median age in Guam is on the younger side. That's probably the biggest effect, but we're still very, very lucky. And even if we continue to trickle in with 5 to 10 deaths a week, right now our 7-day average, we're looking at about 40 cases a day, which is it's come up a little bit over the past 2 weeks. We had a peak in our weekly cases at the end, about a month ago, at the end of August, and then things came down over 2 weeks, and they're very slowly trending up again. Hopefully that plateaus, and it's pretty remarkable that despite the PCOR 1 lockdown and things aren't still going down. One of the rules of thumb that we use is for our 10% case positive rate, if you're detecting 50 cases, the actual number of active cases that are out there is probably about 8 times that. So if you imagine 400 cases walking around active on a single day, and if you do that every day for 10 days, which is roughly average for the number of days somebody will be infected, that's 10 times that. We've got 3,000 to 4,000 people walking around active, and that's just a tremendous number.
Right.
We also talked about a little bit the overall prevalence in Guam. I was actually shocked to see, if it's true that we've reached about 20% of our population having had or been exposed to and now presumably immunized, at least for a few months, to COVID. 20%, if you look at the U.S., is one of the highest, and to only have a fatality rate of about 0.1% to 1% is actually extremely good. Even New York State, I think, is the only state that I could see that actually had a higher overall prevalence of infection. So that's the only silver lining here, is the fact that if we keep seeing about 550 cases a day, our overall prevalence will increase by 1% about every 5 days, and the higher we get, the easier it's going to be to contain flares. We're still going to have cases. There's no doubt that we still have too many people that haven't been infected, that we're still going to have cases, but it will be easier to prevent these rapid surges and these situations where the hospitals may really be stressed again, like they were at the end of last month.
Right. Doc, let's just ask your opinion, right? So we've been in this PCOR 1 lockdown for 7 weeks, right? The numbers have continued to climb, and we've had these easing of restrictions. We were told that they were going to open things up and that it was going to be closely monitored, but we haven't really heard anything about the monitoring that they're doing, or the positives that are coming from this monitoring. And then today we get the announcement that tomorrow there's going to be even more openings. They're going to indoor masses, gyms and fitness centers. You can now congregate up to 5 people. Parks and beaches open. Is it concerning to you that we continue to flip open the switch and we haven't really gotten a handle on this surge, as we now saw 60-some positives, just yesterday?
Yeah. I think, you said we were very lucky with what we have, right? The numbers we're seeing, but are we pushing our luck?
Well, I would feel a lot more comfortable if public health or somebody gave us a little bit more context into the decisions, and we're just not seeing that. I have to believe public health has a lot more data about where these cases are coming from, at least something, and all we get are, probably the most useful information we get are the people that come on your show. If you're not tuning in, you wouldn't hear little nuggets that are important. Is there any data behind saying, hey, we think that if gyms do these things, they're going to be safe? Do we think that if the daycares do certain things, they're going to be safe? Or did they see a number of cases from daycare? It is a little bit paradoxical to me that, the governor very, very strongly kept saying she was going to keep things locked down. And then to allow for these very measured and, incremental openings, especially in light of the fact that, the cases we're seeing now are higher than they were when we started PCOR. So that part I don't understand, her thought process, or whoever's making the calls. I actually think it's okay. My personal opinion, I think that the things that they're incrementally opening are okay, because I don't think they're a huge driver of spread of infection, especially if they're taking the appropriate precautions. I don't know if you guys are the same way, but again, look at 1 out of 5 people in Guam have had it. Perhaps 4,000 people walking around. Look at your own workplace, and 1 out of 5 people, probably have been exposed or have the virus. And in my own workplace now, we're up to three people that have had it, and it's everywhere. I mean, I've heard of medical clinics, department stores, fast food restaurants. I think that the virus is everywhere to some degree. We're all having to learn how to rapidly adapt when somebody in the workplace tests positive, and how the workplace responds to that. It's a big challenge for employers, and for co-workers to have fill in for their staff, and getting them back as soon as possible is a challenge. I like to think that even with these incremental relaxations, that we're still going to be able to maintain this level of now hopefully 40 to 50 cases a day. I've heard Lillian Posada, she says about 20% of those may need hospitalization. So you're looking at, maybe 5 to 10 admissions a day if we keep those numbers, and maybe 1 out of those will need ICU care. So 1 ICU admission a day on average, and are we discharging the same numbers? That's what we need to look at if we're gonna be able to keep the hospital system at a place where it's not overwhelmed. As we slowly march towards a higher overall prevalence, and hopefully we're also able to keep our deaths down. It really comes to, I had to tell my parents, it's hard not to see them, and I have to look myself in the mirror and say, am I doing the right thing? And I have to tell my mom and dad, not to come over and spend time with the kids. And it's hard, but that's, those are the hard choices we have to make in our own circle of friends and family, if we want to protect the people that are most vulnerable and most likely to succumb if they get infected.
I totally agree with the lack of information. I just feel like we had a laugh this morning, governing by executive disorder. I mean, I just feel like we put out these executive orders. We don't hear anything. I mean, the governor hasn't even been like, hey, how you guys doing? It's just like, open. Okay, we're going to open this. And I just feel like when you talk about measured openings, we still haven't even really seen the impact from the first easing of restrictions that we did. And you're right, we haven't had any data. It's at a point, Doc, that we're just grateful. And I will just be really, really nice to public health to make sure that we get someone from public health on. It used to be every couple of days. Now we're just doing once a week on Friday. So you're right. It's really problematic to me that these huge pronouncements are being made from on high at Adelup, and they throw out these executive orders, and we're left to sift through it with no guidance from the governor, no explanation. You're right. There's no data. I mean, I could understand.
I also want to just point out, during that oversight hearing with public health, I'm not sure if you saw it, but I just kind of got a little bit of it. And there was one part when Dr. Ann Pabutsky was being questioned, and there was something that she said which I thought was very interesting, and she's going to be on a little later. But she was talking about the Physicians Advisory Group, and how, I want to say she said there's only 2 people from public health that are actually on that board, and the rest are comprised of private physicians. And so they're the ones, who primarily have the ear of the governor, and giving her, and in which she bases her decisions. Yeah. And so I just wanted to throw that out there, because I know everybody's like public health, but they really, they only have two spots on this.
They should have more of a presence. I'm also concerned that public health, I mean, there used to be what looked like a lot more independence when Linda DeNorsi was kind of running the show. But then when you talk to the PAG, though, Bree, it's like we're told by public health that the PAG advises the governor, but whenever we talk to the PAG, they're like, oh, we tell her, but it's ultimately her decision.
Right. Yeah.
Yeah, I don't know. It's I've heard that I've heard that everybody's mostly on the same page in the PAG, and they put their recommendations forward. I think that, early on we didn't know what was going to happen, and I think we were all very concerned. And now I've come to a place of just acceptance that we're just not going to get explanations. We're just not going to get the type of information that would just help us to process what's happening, process the daily numbers a little bit better, process the executive orders a little bit more. I think they just want us to push the I believe and I trust button. And On one hand, again, we're doing well, maybe 1/10 fatalities, that's good, and for that reason maybe we shouldn't question what's going on, but we're all thinking people, and I think we all want to understand what's happening a little bit better. It'll help us make better decisions in our lives. It'll help the providers in our daily dealings with our patients and being able to give them better advice, because they're coming to us with questions and we don't know any more than you guys do necessarily. I think there's a small group of people, maybe in the PAG and public health and within the governor's circle, that has access to more information, and maybe everything makes a lot more sense to them. But it's just too much trouble for them to try to explain things, or they don't want to have to deal with the fallout or the questions and the criticisms or the analysis that might come from the woodworks, like from us, and they just don't want to have to deal with that. So
that's the life you chose, though, right, Doc? That's the life you chose.
That's true. There's certainly that sentiment that, hey, you're a public figure, you got to be willing to stand up to the criticism and take those questions, right?
Doc, with the PAG, right, and we talk about lack of information, I think it kind of goes back to the transparency, where if these meetings were open to the public, then we would have a better idea about what's driving these decisions. I mean, it could be something as simple as one guy talking louder than the other guy. We don't know. You know? And this argument I appreciate that we get Dr. Wen on the show, because, I mean, it's great. We do get that information from these meetings. But at the same time, this argument that, if we open it up to the public and the public can watch the meetings, then no one's going to say what they really mean. And, well, tough. You know what I mean? There's a process with all the other boards that, the public can key in on these meetings. And, to me, it's just, if they were transparent and we could see, if they're not going to give us the data or explain any of this logic that goes into the decisions, then
it's gotten so bad that the whole issue of quarantine, for example, is in court. And they want answers and explanations. Says, how is quarantine effective? Can you explain? And then it may get to the point where they have to subpoena the state surgeon cell to come in just to explain.
Right. Yeah. And how's that, Doc? I mean, they first tried to get him, and then they said, "Oh no, he's under the guard with DO." Talking about the surgeon. What is he? Surgeon General or
State Surgeon?
Dr. Mike Cruz. So they were having the hardest time getting him to show up in court to testify about this quarantine, and now they're. I think the AG's office was like, "Oh, if you want to send a subpoena, then send a subpoena," which is crazy. Like, we've never had Dr. Mike Cruz on this show.
Exactly.
You know what I mean? And for someone who is key, I mean, he's like the COVID czar, basically. No accessibility, no transparency, no ability to ask questions. It's crazy. It's actually pretty crazy.
It's kind of, it's a little disappointing. I mean, talk about an opportunity to be a leader and to stand up and be, be the voice that people come to and listen to. It's a wasted opportunity, and it's a bit of a vacuum in terms of leadership and sanity and knowing, what how are these decisions being made? And in his position, I don't know, what his reasons for not putting himself out there a little bit more. Maybe he's got his personal reasons for that, but
you can't be personal during a pandemic. That is ridiculous.
Yeah. And
there are people out here dying.
Yeah, and Doc, it's worse than pulling teeth. Like, and we've had a good working relationship with Dr. Cabrera, and a couple weeks ago. But
he's been in court.
Right, he's been in court, right? And a couple weeks ago, we had it set up where Dr. Cruz was going to come on, and it was like a last-minute thing. They're like, oh, yeah, cancel, and we just never got anything after that. Like, is he going to come back on or what? I just feel like if they're not going to explain these decisions and at least give us the opportunity, because they don't want to do a press conference, because every time we ask the governor a question, she gets pissed, and you can see it. So I think, Doc, what it is they can't explain the logic behind these decisions because maybe there isn't any.
Well, I'd like to give them a little bit more the benefit of the doubt. I think there is probably data behind what they're telling us, but they just don't want to. They don't have the patience to try to explain it to us, or don't think that it's going to go over well, no matter what they say. And I get that too. I mean, it doesn't matter what they say; somebody's going to have something negative to say about it. And they've got to just not deal with that. And
that's a
whether
shame.
or not that's justified, Yeah.
You should be able to answer, to your decisions and explain your decisions, good or bad.
Yeah, that's basic, and
I
it's
think people would be understanding when you explain, the rationale behind things.
I think the majority of people would be understanding. And again, here's an opportunity to build trust and to build to improve that transparency, so that people do believe it, and they do start to trust the things that are said and being made, and even more willing to give you the benefit of the doubt. But you got to earn that trust by being transparent and by explaining things.
Yeah. When people are hungry, businesses are shutting down, people are dying, positive cases are going up, people are in the hospital fighting for their lives. I don't think it's unreasonable to ask our top leader of this island and people who are leading this COVID response to come on or even hold a press conference.
Jesus.
Explain.
I'm tired. I quit asking.
I'll say this too, though. I mentioned, we're lucky that our fatality rates is as low as it is, but how much better things could have been if we had better contact tracing, if we had better hospital facilities set up, and if we're an island, and could we have been a New Zealand or a South Korea if we had done things a little bit better? So that's the flip side of all this. We're lucky to be where we are. Things aren't worse, but man, things could have been potentially a lot better too.
I want to read this. I was texting with Dr. Hoa last night, and he's coming on. But he put, our positivity rate is going up. Companies are making big mistakes of allowing employees to return to work while tests are pending. Need to spread the word to companies that if you have your employees tested due to close contacts, they all need to be sent home while tests are pending. And if your household has a positive case, then the rest of the other members of the house need to stay home and inform their respective employers that they have a positive family member. See, when you get information like that, it makes me wonder if that's what's happening, then why don't we kind of get a hold on that before we open a bunch of other things?
Yeah.
But we're blaming it on the businesses now?
No, they're not. We're just people who got to work. So maybe they're just going to work when they're I don't know. You said yourself earlier, Doc, it's a struggle when someone has to get tested or pops positive. Of course, in any business or company, it's going to throw a wrench in the whole operation.
Absolutely. It throws a tremendous wrench, and just having to deal with that now week after week is very challenging. And I can understand, people want to go to work. They run out of their FFCRA leave. They run out of their sick leave for having to stay home with their kids. You get a cough or a sniffle, and you're obligated to stay home and get tested. And and even if you're negative, sometimes they still make you quarantine just based on your symptoms. And it's untenable for long term. And I can understand why some people are going to push that boundary. It's a risk. Again, you got, if you want to keep yourself and your family safe and our loved ones safe, you've got to take symptoms seriously. If you have a fever, cough, the classic symptoms, you just cannot put yourself out there in a place where you're going to be exposing other people. I mentioned we've had 3 cases in my clinic. We've got 30 or so employees, so roughly 10% as far as we know. And as far as we know, nobody that was positive in our workplace spread it to anybody else in the workplace. Okay, so take that for what it is. And we all mask up, of course. We're doing social distancing, and so I think from one perspective, if you're doing the right things in the office, at least you're going to protect one another, and that's important. Mm-hmm. But I've also heard that there are some places, some facilities, businesses where it has spread within the office and space. So. And that's likely because of what Dr. Nguyen mentioned is people are coming to work and they're sick, and that's something that message certainly has to get out there. But I do think that businesses can open safely, and I think we have to allow for that to happen. At the same time that we're stressing the importance of making the right decisions.
Yeah, and I think what's problematic is I agree we definitely can't go forever with businesses being closed, but I'm just not confident the government of Guam is doing their part to improve the COVID-19 response on the virus end of things, right? I get the whole economic argument, and I was at Ross yesterday. Place is clean. They have a ton of employees. You look at something, they spray it down. So businesses are, they are doing their part. But what is also concerning is if, like you had said, so many people are walking around active, and these people are going here, they're going there, going there. I mean, I see that as a problem, and I'm not trying to say it's the businesses. I'm just saying if you have a lot of positive people and they can now go all over and do all kinds of things, then I'm just assuming that we're going to see spread. So it really comes down to us just policing ourselves, and we're not getting any help.
Yeah, at the end of the day.
Yeah.
We're fending
Yeah,
for
because,
ourselves.
a lot of us are asymptomatic too, of those, 3,000 to 4,000 walking around that are active, potentially 30 to 40% of them are asymptomatic. So, you can't blame them for going about their business and going to work, but they, that's where the universal, precautions that we're talking about with masks and washing your hands and social distancing, that's where those things really are going to pay benefits for us.
Well, Doc, don't really want to ask what your predictions are for deaths in the coming week, but what's your prediction?
Or what are the numbers showing?
I think my numbers had shown 47 by Sunday, so we're already past that. So the week after that, based on last week's numbers, would be another 6 deaths. So that one-ish per day is looking, like if the numbers stay where they are, we're about 12% of all of our cases are over 60, and that's really the driver of most of the fatalities. 10 to 12%. We've been staying around that number for the past few weeks. The highest it was about 14%, but we've been about 12% for the past few weeks. So if that holds the same and the numbers hold the same, I think we're still going to be looking at 5 to 10 deaths a week, unfortunately. But again, better than perhaps we deserve.
Oh, there you go. Thanks, Doc.
All right, guys.
You.
Thanks for having me
Be
on.
safe. Right on. Wash your hands.
Take care.
7:13. It's the link. Let's go to the KUAM newsroom where our the Nanus have sanitized everything, and we have Poly Mike Crisostomo standing by to talk about this weekend's indoor masses. Good morning, Father.
Hi, good morning, Chris, Sabrina, Jason.
Good morning.
Getting to be a regular here.
I know we gotta get you like a nameplate for your area in the Zoom room.
Come on to our Catholic radio station.
Right on. Yeah, maybe we'll do a role reversal. Polly, so what are we looking at for this weekend in terms of where people can go to indoor masses and when?
Well, people can expect, again, and it was a message to our faithful that not all churches are going to be opening this weekend. I've already received messages from several pastors who do not have a plan in place yet. They're putting that together. They are looking at getting more resources and personnel, manpower to help with temperature checking, contact tracing, and things like that. So not all the parishes can. I know definitely for Tamuning, we are ready to open up, and we'll do so this weekend.
I wanted to get your, and maybe even the Archdiocese position on this, because the executive order, the guidance that came out with respect to churches, I believe the maximum capacity was 25%, but the Archdiocese of Vigaña set it at 50%. Are you guys going to reduce it to 25, or are you going to stay with 50?
The Archbishop's letter, it does not change. It stays. But I can assure you, Sabrina, that we have not even reached that capacity. Mm-hmm. And why I say that is because part of our protocols is to rope off pews, and we've roped off every other pew in our parish, for example, and when we counted the numbers, it was less than 50%. I would say we're at about 25-30% capacity at this point if we were to allow people to come in and be seated. For example, a pew that could fit 8 to 10 people now will probably fit only 2 to 3 people comfortably with the 6 feet social distancing. And so we're very confident that we have not reached that 25% capacity. In most churches, almost all of our churches have roped off their pews like that. And so I'm very confident that we have not reached it, but we're not changing Archbishop's letter. That will still remain.
What did you make of that? Because I'm not sure we had got to talk to you after the response from Adelou came out, wherein the governor's office had said that
y'all knew about it.
You guys knew, and this almost seemed like when you ask your parents to do something, and then they say no, and then you go and do it, and then they say, okay, go ahead and do it.
Yeah, I personally was, kind of zeroed and honed into that statement, and I was asking some of our priests about it. officially we were never informed about any considerations. And now, mind you, remember I wrote my letter to the governor and she responded to my letter. So maybe that's where they're coming from. Maybe they're saying that, well, we told Polly Mike, that we're considering this, but all she said was that it was certainly top of her mind, that they were talking about it with her physician advisory group, and that, to be patient, and they thanked us for being patient, but that was it. There was no reassurance, and I shared this earlier, there was no reassurance that churches were going to be reopening this weekend.
So no.
Yeah.
Y'all didn't tell Polly Mike or Polly Paul or any of the Pollys.
Yeah, remember, we've always asked this, we've always shared this, bring us to the table. We're willing to be there, slap us in our hands if we're not doing well, but praise us for the things we're doing. We've done nothing but given our protocols in place, and that's all we continue to do, and that's the best we could do right now. Understanding the governor's position, we certainly respect that, and we move forward. So we're looking forward again to a reopening this weekend.
We have a comment here from Jesse. So the church isn't going to listen and follow the governor's executive order.
No, I mean, we are. In fact, we complied with those orders, and the 25% capacity has been met, and I think most churches are at that point as well. The Archbishop letter says 50% capacity, and that's again, we can open up with that, and if we reach that, then we do. I think we're going to take the measures to be able to help protect our people, and that's what we've done so far.
Right on, Polly. What about other things that, because I'm not sure the status of anointing of the sick and all those other types of duties performed by the church, are those, have they been being conducted, or?
Like baptism?
Yes, in fact, as far as the anointing of the sick and last rites, Father Jeff has been our chaplain at GMH, and he's been responding to requests from family members. And the process now, Chris, is that if a family would like their loved one visited at the Guam Memorial Hospital, they are to let their charge nurse know, and then that charge nurse will contact Father Jeff. Father Jeff then will be escorted through security at the hospital into the room. And mind you, Father Jeff has been trained with public health and GMH. He has the proper equipment that he wears, and he dons himself. Every single patient that he visits, he has to take on and take off. So we are very fortunate that they have allowed us to come in now and be there for the patients. Now, not every COVID patient that has died has been visited by a priest. Not everyone is a Catholic, but we're trying to get the message out that it is possible for a priest to visit, to be there with anyone, not just Catholics, but to anyone who's alone, who's dying there perhaps, who would like someone to be there. Father Jeff has been allowed to do that and to go in. As far as baptisms, we're doing that by appointments now. It's unfortunate we have to do that, but it is the way it is. Funerals, as you know, has been a controversy with Monsignor David's family. We are able to proceed, and we will be having his funeral very shortly, and we'll be going in there with the capacity level that's been asked of us to meet. So we are happy, and we're pleased that we are proceeding with the sacraments being more accessible.
Polly Mike, I'm sorry, I may not have heard it, and maybe you did say it, but just for clarification, you said that not all churches are going to be opening this weekend. Is it because some of the priests have expressed that they just don't feel comfortable holding Mass indoors?
That's correct. Yeah, that's correct. There are various reasons. I know one priest that has comorbidities, has pre-existing conditions, and they just don't want to expose himself to that. And his minister says, Father, no, let's not do it this weekend. Maybe next weekend. Let's give ourselves time to get things in order, back together. And so we've had those cases, and we respect that. And we're going with what the parish is telling us up at the chancery. So we certainly respect that an archbishop does that and indicated that in his letter.
Okay, Polly, thank you. Any closing words here for the people of Guam?
Actually, no, but I thought I was going to talk about the Silent Witness program.
Oh,
Silent Witness Project. But
Go ahead, Polly. Sorry.
Always happy to talk about the church, but
right on.
Again, the Silent Witness ceremony, as you know, the governor will declare and proclaim Family Violence Awareness Month, and the Silent Witness is a project that was started a while back here on the island to remember and honor the lives of many of the men and women and children who have died of domestic violence and sexual assault. And so we're going to get the word out. And at 11:30 today, we'll have the proclamation ceremony and the silent witness ceremony, which will honor. So if you see red silhouettes of individuals around the island at businesses or churches, these are the voices or the persons that have given of their lives because of DV and SA, domestic violence and sexual assault. And so please remember all those who have died.
Is this going to be streaming, this proclamation signing and ceremony? Because I know that there have been ceremonies that the governor's held and the media hasn't been invited.
That's correct. The families could sign on. Anyone could sign on Facebook. It's Silent Witness Guam. Of course, on our Facebook, Silent Witness Guam. And if they do not have any Wi-Fi, they can contact the coalition, the Guam Coalition, at 479-2277. They've set up a place where families who do not have internet can come and attend and keep, of course, with social distancing and wearing their facial masks.
Right, you said families, but what about the media?
I think the media is invited. Hey, you can come over to St. Anthony's. We'll welcome you.
Okay. All right. Thank you.
Thank you, Polly.
It's 11:30.
Okay.
11:30.
Okay, we'll see you. Be safe,
All
Polly.
right.
Okay.
Okay, God bless.
Okay,
Bye-bye.
hasta luego. 7:22. Take a short break and coming back with the Department of Public Health and Social Services next on the link. Good morning, Guam.
We're celebrating your
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Our frontliners have been working tirelessly to keep us safe, and now they need your help to get our island back up and running as safely as possible. Did you know your smartphone can be one of the most powerful tools in our fights against COVID-19? That's why we're bringing you the Guam COVID Alert Exposure Notification app. This app works by letting you know if you've been exposed to someone who's positive. It's completely voluntary, and more importantly, it's completely anonymous. It does not track who you are or your location. Researchers at Oxford University have found that for every 100 to 200 downloads of the app, it can prevent 100 infections and save one life. Add your phone to the COVID fight by going to guamcovidalert.guam.gov or download it from the App Store or Google Play now. Help Guam stop COVID-19.
These are some of the signs that someone is thinking about suicide. Talking about wanting to die, excessive guilt or shame, and feeling like a burden to others. Feeling empty, hopeless, trapped, or having no reason to live. Feeling extremely sad, anxious, agitated, or full of rage with unbearable emotional or physical pain. Other signs include changing behavior, such as making a plan or researching ways to die, withdrawing from friends or saying goodbye, giving away important items or making a will, taking dangerous risks such as driving extremely fast, displaying extreme mood swings, eating or sleeping more or less, and using drugs or alcohol more often. If you or someone you know is showing these warning signs, get help as soon as possible. Call Guam Behavioral Health and Wellness Center's crisis hotline at 647-8833 or 4.
You're watching The Link with Chris and Sabrina on TV 11. Stick around because we're next on CBS This Morning.
Friday.
The local boys are cruising it, we're checking out the scene. Gotta find a women, where can they be? 'Cause I say, love for an island is what we do. Lovely women, beautiful beaches, just to name a few. Fiestas and barbecues.
Good morning. Welcome to The Link. Proudly brought to you by Carrier. Thank you, Carrier. Cabo Enterprises, ITD, and the Thrive Coalition, where it takes a village to raise healthy and drug-free youth. Come on and thrive with us. They've been enjoying our virtual malasadas in the KUAM News Zoom room. I hope you like that virtual Starbucks, too. It's decaf.
Delicious.
The virtual malasadas, it's low to no fat. So feel free to have a couple. Hey, after that oversight hearing yesterday, this is going to be a walk in the park, guys. Good morning from the Department of Public Health and Social Services. At 7:27, we have Annette Uggan, who's the contact trace lead, and Dr. Annette Pabutsky, the territorial epidemiologist. Good morning, ladies.
Morning.
Well. So we have a new executive order out. And it looks like more things are opening. I'm going to start with Dr. Ann. Are we at a place, and are we confident with the first easing of restrictions and the monitoring that went on with that to now open more businesses and establishments and ease more restrictions?
Well, that's the governor's call, and the Physicians Advisory Group advises her on things like this. Our numbers are still not where we want them to be, but they are coming down, but we are seeing deaths almost daily. Yesterday, I did the calculations comparing Guam with Hawaii. Guam has, as of the 30th of September, so we have almost 2,500 cases in a population of 169,000. And 49 deaths. Our death rate is 29.1 per 100,000 population. Hawaii's death rate, with a population of 1.4 million and 1,200 in some cases, is only 9.6. That's the death rate per 100,000. Our case incidence rate, it's up to September, is 1,478. Hawaii's only 874.2, and we're a lot smaller. So we have much higher infection rate and, at least incident rate, and much higher death rate. And in the words of Anthony Fauci, never underestimate a pandemic. Last month, he talked about we shouldn't underestimate a pandemic, and he used the analogy of HIV and AIDS. And where it started in the 80s, it was like, oh, it's just a few gay men. Who cares, And then it was 5 gay men, and then 26, then thousands. And now we have millions of people who have been infected worldwide. It's a worldwide pandemic, and millions of deaths. So never underestimate a pandemic. We're just at the beginning of this. So we just have to see what happens. If you were talking about the churches, I saw some media postings from the Philippines where they showed the inside of a large Catholic church where people were sitting 6 feet apart, wearing masks. Let's see what happens when we open up, because people can't stop wearing masks and social distancing. And just because things ease up and open up doesn't mean you have to stop what you're doing. You still have to wear a mask. You're going to have to wear a mask for 2 years. So stock up and wash your cloth mask. And you're still going to have to social distance. It's a respiratory illness. It moves a lot faster than HIV/AIDS. And it's going to be with us for a long time. And I know people think we have to live with this virus. Yeah, but these kinds of analogies where we talk about it's war and we're going to expect casualties. Here's my other thing. There's a lot of premature mortality going on. And there's disproportionate mortality. If you want to discuss that, I'm happy to do that.
Dr. Ann, okay, those numbers didn't sound so good, that comparison between Hawaii and Guam. And how much of you've always said that, the decision is up to the governor and the physicians advisory group, but how much of a voice does public health, because people are out here talking crap about public health, like, oh, they're not doing their job or whatever. So how much of a voice does public health have on this physicians advisory group when these decisions are made?
Well, of course we participate, but the ultimate call is the governor. And so people, yes, we know people are talking about public health. If you open things up, we're probably going to see another surge. That's how these things are patterned, and we will try and deal with it. We have a lot better.
Sorry.
Is that out of loop?
All right, no, somebody's trying to call me.
Yeah.
We have a lot better testing capacity now, and the problem again is our infrastructure and what's going on at the hospitals, and they're seeing non-COVID patients now. Dr. Cabrera was showing some of the stats on the hospitalizations, and there's other things happening besides COVID-19 that we have to also address.
Right.
Doctor, and how many people are in the physicians advisory group?
There's about 20.
Well, how many seats does public health have?
Well, there's myself, and then there's the two physicians from Guam Memorial Hospital. And Dr. Manglonia was also on it. She still is, but she's not representing public health.
So it's just you.
And of course, they ask public health to participate as needed when they have specific questions, and they confer with the director. So there's a back and forth that goes on.
Right.
Okay.
So,
So
I mean, I don't know, Doc. I'm just frustrated because I can see that you as a subject matter expert. I mean, you're the territorial epidemiologist. You kind of know about this kind of thing. So when we hear about these decisions to reopen, and they come out in the middle of the night with no supporting information whatsoever, and then we get you on in the morning and you're saying, hey, if we open, we're going to see another surge. Or, hey, our numbers are not where they need to be to open. And, hey, it's the governor's call. And it's frustrating because I know a lot of good classified employees who try to do their jobs and, they get muzzled or they get caught up in the politics. So it's just really hard to decipher and to make sense of what we're hearing from what's allowed to open and what you're saying from an epidemiologist standpoint.
Well, I tend to have a more pessimistic view because I do look at the statistics. And right now I am looking at the deaths. I'm looking at the deaths and the death certificates and trying to make sense out of some of the disproportionate mortality we're seeing and the premature mortality. And it's not nice looking at these deaths. It's really not nice to see. It's terrible. I mean, these are innocent bystanders. So it doesn't, I tend to be more pessimistic. The other thing is we keep going back to this. It really depends on how the community behaves. If we open things up and everybody just says, oh, great, the pandemic's over, behaves as if, and goes to bars or the bars are still closed. Okay, they go to church, then they start having fiestas and family gatherings, and then we see more and more spread. It really depends on how seriously people take this.
Yeah,
there still is virus out there. It's spreading. It's in workplaces. We're seeing it in some congregate settings. There's a lot of household spread. And Annette can give you a little more, specifics on that. But somebody was talking yesterday, why do we see so much in Chamorro, Filipino, and of course Chuukese households, including hospitalizations and death? Because these are the people who have multi-generational houses, and with the Chuukese, they might be in overcrowded housing. So you're going to see more spread there. So it really depends on how the community responds, and it doesn't matter how pessimistic I am and how optimistic the physicians advisory group is. They want to see the economy open up, and I think that's also important. But when my job is counting the sick and the dead, it's not a nice job. Sorry, I tend to be more pessimistic when you see very, very sick people and people dying. And by the way, we went through the deaths. Half of them have the comorbidity of diabetes, and of those, 1/4 have end-stage renal disease. It's a huge risk factor.
You say
don't-
pessimistic. Some people may say realistic.
Yeah. Ooh.
We're working with the Diabetes Community Coalition on that, and
Yeah.
to do some more education on how important it is for people with chronic conditions to manage their disease properly.
Right.
And also, if you're really sick, maybe you can go see your doctor if you're feeling sick, and they can test you, especially if you have a comorbid condition. And if need be, if you're not, you don't have to be hospitalized. Maybe they can manage it somehow better with whatever, and counsel you on what you should be doing for the elderly people with chronic conditions.
Doc,
Because
when you
those are the risk groups.
yeah,
3/4 of the deaths are people over age 55 with chronic conditions.
when you talk about it's up to the community, well, I think we failed because we've been locked down for 7 weeks and things are just getting worse, right? So I don't anticipate.
They're getting a little better. The cases are going down, but the deaths that we're seeing they lag because these people who got sick and then died. This started in August and it went through September. There's always a lag because some people might get sick and last for weeks, on a ventilator in the hospital and before they die, and that's not nice. But this is what happens. So yes, the numbers are going down. It's not down to where we really should be. We're all back to normal. But they are trying to open things up. Businesses want to open. People want to go back to work. And of course, eventually they want the tourists to come back. And they keep touting Hawaii's going to bring the tourists back. Well, let's see what happens over there with that.
Let's go over to Annette now. Good morning, Annette. When Dr. Ann says it's getting a little better, just looking at the results that were reported yesterday, 62 positive tests out of 434 tests taken.
Yep, it's still double digits. Like Dr. Ann said, it's not where we want it to be. We want to go down to single digits and eventually to zero. Unfortunately, just even comparing last week's sit rep to yesterday's, the 1 week difference, the majority of our new cases that, in that 1 week time, 101 were household contacts. And so that's the biggest group of contacts that had an increase from, comparing last week to this week. And it is unfortunate, but it's to be expected. They're the ones in close contact, exposed on a daily basis. And like Dr. Ann mentioned, it's the multi-generational, large households that we have here on Guam. I mean, it's just our culture, right, as Pacific Islanders. And so unfortunately, we are seeing more and more household members who are turning positive. As well as work contacts. And so, again, it's that ripple effect that we've talked about. And unfortunately, we're seeing, people who are still sick, going out and about, visiting family and friends, going to work, exposing, family, friends, and coworkers. And then those coworkers bring it home to their family, and then it just starts all over again. Household members start to get sick. Or you'll see households where multiple members are symptomatic. And then once we get them tested, they're becoming positive. And so that is our biggest challenge as we still see these double digits, And so, again, we have to encourage people. Like Dr. Ann said, social individual responsibility. And I know we have some households who've done great, some workplaces too that do their part, and we don't see ongoing transmission in those settings. But we unfortunately have those other areas where it's just 2-3 households. They're next door to each other. There's constant moving back and forth. We ride together in the same car, so they're packed into the vehicle. They sleep over at each other's houses, even if someone's symptomatic, or they're helping take care of the child. And that's just something that our team has to work with, make sure we educate them, test them. If they need to be separated, be positive cases put in isolation facility, or exposed individuals put into quarantine facility, we work that out with our other teams in the department, just so we can help stop the transmission and continue to bring those numbers down.
What are the numbers showing out of the government quarantine facility? We just implemented the 6-day early or 7-day early test out for home isolation. What are the numbers showing for people coming into Guam? Or a lot of them have COVID or not?
We are seeing a few that 1 or 2 on the test out process that's been implemented due to the judge's order, and so Fortunately, we've caught those individuals before they're allowed to go home and home quarantine. So can you imagine if we weren't doing the government quarantine for arriving passengers? If we're seeing one or two, being tested out on a daily basis, that can lead to about 3 cases each, and continue on and increase our numbers of positive cases. And so I know it's not everyone agrees with it, but again, it's something that has shown, we've had over 100 some cases tested positive in quarantine. And so can you imagine the ripple effect if we did not find that out and they were just allowed to, go back home and again, we're dealing with those who are non-compliant while we have others who are very compliant. I mean, we hear it out in the media, the ones who complain and are not happy, but we have hundreds more who are thankful that, we're doing what we need to do. We've had people ask us to put them in isolation or quarantine. So that just speaks to those people who are concerned about their family and loved ones and are being responsible and wanting to make sure that they're not the reason why it's spread over to family and friends or coworkers.
Right. And I think also some people are upset that they've applied for, hardship release and they weren't, where other people were getting special treatment. So.
Yeah, without a hardship.
Yes. It's understandable, and it's something again we've updated, revised, adjusted our processes as we've gone along, and again, it's something new for all of us. It's a novel virus, and and as we see the data, we strive to improve, be more efficient. We are concerned and we are compassionate about people's needs, and why that's definitely the hardship. But again, our overall goal is the health and safety of the people of Guam, and that's the utmost importance to us. And so we try to balance that out. And unfortunately, as you said, we're being bashed left to right. We cannot please everyone, but again, it's the health and safety of our people is what we strive for.
Right. We had a comment here. Daycares can open, so child care centers are able to open Monday. What about schools, Dr. Ann?
I'm not sure. I think it depends on whether the schools are ready. I really don't know. You might want to get someone from DOE or the private schools on.
No, I didn't see that.
I really don't know the details because the talk was they have to be prepared to open and have whatever their procedures are in place for social distancing kids, which is really hard.
I don't think it's not on the list for sure because we're under PCOR 1.
People are just saying,
PCOR
asking,
1 point something.
The logic, I guess, is that if daycares can open, well, what about schools?
I haven't seen the executive order. I just came straight in and talked to you guys.
No, Doc, they're not allowing schools to open. Yeah, we're just saying that people are thinking, if daycares can open, then why can't we open schools? So why can't we open schools, in your opinion?
Well, I think we probably should if everything's going to be open up. But again, they have to have some kind of procedures in place for how they're going to do social distancing while the kids are inside classrooms. I think some of them will still be online, like the high schools. Don't the kids have tablets or something? I really don't know. You're going to have to ask. I think that's a good question for the DOE and the private schools, Catholic schools.
Yeah, I don't think they can if we're in PCOR 1.
There's a percentage of occupancy that they're allowed to have, so that will reduce the number of children that actually can attend the child care facility. Right. The situation with the schools, and again, yes, they're the subject matter expert to talk about that, but if we're limiting the child care facilities on how many children can attend, that will put a further strain on the school systems, because now if you're allowing some to come in person, but the teachers still have to do online classes, we don't have extra teachers to accommodate the two settings, that's a further strain on DOE and makes it difficult. Right. And so that we're dealing with larger classrooms, and so that's something that we're not in the PCOR stage that allows these schools to reopen.
Yeah, but we can't really say anything about the PCOR stage we're in because PCOR 1 is basically out the window.
Yeah, we're like what do they call it? PCOR 1.5.
We call it PCOR fun around here. Around these parts.
The original PCOR designations were designed to how do we get into from P-Core 4 back down to it wasn't designed to go the opposite way. So it's basically playing it as, let's do it, figure it out as we go along kind of thing.
Real that.
Oh, wow.
That's real comforting.
Feels so good.
Yeah.
I really don't know if I don't think that there's been a formal designation for how to go back and forth. It's not like typhoons because we still don't know.
No, there was.
And when the surge happened, it was more of a dire emergency because the hospital was overwhelmed and people started dying. That was just a call. Oh, no, let's lock it down again. Doesn't seem like a lockdown to me, except for the stores being closed. If you look at the traffic, it's gone down a little bit, but it seems like normal traffic to me.
Peak or fun night.
Yeah, it's peak or fun.
Well,
no, but Doc,
public health emergency, peak or flood.
There are limitations on social gatherings and congregation. That's really important to keep that going. And it's like, don't forget the masks and the social distancing. This is not going to go away. You still have to stand 6 feet away from people and wear a mask, and no large parties, etc. And I think she's trying to incrementally open up and see what happens, see if people can behave. And it's really not just individual responsibility. It's individual responsibility for you as a person, but what you're doing is what you do affects the community. So it's really both an individual responsibility and a community responsibility.
I like to refer to it as collective individual responsibility. So if we collectively be responsible individuals, then as a whole, we can beat this thing. Doc, I want to go back to what you said. Yeah,
okay?
Right.
That's the problem. And you might have somebody come in on a plane and lie and say, oh, no, I live here. I'm a resident. And they're not. And they go, all kinds of things can happen. People also lie about their phone numbers when they go into quarantine, or they give the wrong number or whatever. Wow. I mean, we can't stop people from lying and cheating and stealing. There's always bad apples. But we want to see, the community kind of still come together and work on this. Nobody wants to see these premature deaths.
Yeah. I mean, there were rules to moving from P-Core to P-Core, but they threw them out the window. So we were told that, the testing positivity rate has to be declining. It's not really. I mean, it was 14% yesterday. The last 7 days, it's 9%. Yeah.
Hospitalization, testing capacity.
Hospitalization decreased because so many people are dying. Yeah, so there were rules, Doc, and they just changed them in the middle of the game because there was a lot of political pressure. And that's where we're at this interesting place where we definitely have to restart the economy, but at what cost, right? So
it's basically you just have to go out there and, you're taking a risk every time you step out the door. So protect yourself. Wear your mask. We're on our own. Yeah, because you're hearing it right from the subject matter experts that the virus is spreading. Present tense.
You can also make choices. You can say, no, I'm not going to this. I'm not going to church. I'm going to stay home and, whatever. I'm going to not participate in this party. I am not going to go to this fiesta if there is one. You can also choose to isolate yourself and say, I'm not going to do those things because I don't want to put myself or my family at risk.
Right. Or you could be like, I'm going to wake up tomorrow and I'm going to go get the dog a skin tight fade. Then I'm going to go get a tattoo. Then I'm going to grab a workout at the gym. And then I'm going to go to Mass. And then we're going to go to Ross. And then I'm going to go to the daycare. And then I'm going to have my gathering of 5. But it's really going to be 500. Yeah. Our people. Our people. Let's get our act together, guys. Really. Annette, we're kind of going to wrap here, but where are we with this? So, and I just wanted, we had 62 positives yesterday.
Yeah.
Yeah. So what can you tell us about anything more specific other than household contact?
Any clusters?
Well, unfortunately, because we're seeing more households coming down with COVID, you can say there's clusters within that large household size. We're working with again dealing with work contacts and getting people screened and tested, getting them isolated if they're new cases. We just had some individuals yesterday asking to be separated because another family member became positive, and so they want to be moved to the ISOFAC so they don't further expose their loved ones at home. And unfortunately, that's what we've been dealing with over the the course of the past month or so. As we see the numbers go down since that big spike end of July, August. We're still dealing with double digits, and unfortunately, that's what I have to keep repeating to people. It's people your love, it's your family, it's your friends that unknowingly are spreading it to you. We're still seeing individuals symptomatic and asymptomatic. Unfortunately, they didn't know, and I know it's this whole we need to recover the economy. And again, there are individuals who they're the breadwinners of the family and they have to go to work, but but if you're symptomatic, you got to stay home. There are people, how many days they're symptomatic, they're not seeking medical care, and they're going out and about, and then unfortunately they're going to the hospital because it's been days or a week that they've had a fever and their symptoms have worsened, and then finally they're overwhelming GMH, where they could have gone to their primary doctor and be seen sooner and avoid overloading GMH. They already have a lot on their plate. They got to focus on the really ill and help those recover, help our frontliners, give them some breathing room and give them a break as much as possible. It's, again, behavioral change. I hope people learned and, our hard lessons from that July, August spike. We haven't even come down from that curve. So again, as we reopen slowly, I hope people, again, don't relax too much, They don't need to go to Ross. That first day, and we saw the videos and the pictures of that long line. It was just very disappointing. I don't blame people. They're tired of being stuck in the house. But again, even just bringing everyone to go out and do simple things of shopping. Do you need to bring the whole family? Just one people and do what you need to do and come back home, quickly and safely, so that you can help us stop the spread. Because again, we definitely can't do this alone. And again, it's just a constant, oh yeah, I was sick, but I went to work. Oh, I was sick and I went to visit family and friends. Oh, I was just there a few days ago, and to find out, oh, they got exposed, or they're the ones exposing people.
Thank you, Annette. Dr. Ann, final words?
Related to that, I don't know if they've changed it, but in the Philippines, they only have one designated household member who's allowed to go out and shop for the family or the household. So, and they're seeing a surge over there, but they're also trying to open up, and so is Hawaii. So we just have to see what's going to happen and how people continue to behave. Because again, as Annette said, we're seeing mostly household contacts. That's the majority. There's some community contacts. We're seeing a lot more workplace spread, but it's households. But we don't have nursing homes, so we don't have the same problem that they do in the Estados Unidos. We don't have large nursing homes. The elderly stay with the families. That's part of the problem. They might get exposed there instead of at a nursing home.
Flexing your Spanish there, Doc.
All right.
So at the end of the day, really, everybody, if you don't have to go anywhere, just stay home. And if you do go out, wear your mask.
And social distance.
Exactly.
Yeah.
And don't wait too long to see your doctor if you're feeling sick. We don't want it where you wait too long and the only option is to call the ambulance and go to ER. Our healthcare providers have stepped up from day one, and they're doing their part. And they've said it all along too, is, see your primary doctor if you're feeling sick, just so that we don't overwhelm GMH's ER or GRMC's ER, because we want to make sure it's the really ill, the critically ill that are able to get in and be seen and have those ventilators and, and have the attention of our nurses, we don't, and the doctors. We don't want to continue to spread our healthcare providers too thin and overwhelm them, right? Because we're not out of it. Like Dr. Ann said, it's, we've got a while to go for this pandemic. And so, we've been fortunate. We had DOD come in and help GMH, but that was for a short time.
Yeah.
We won't.
The rest of them leave this weekend.
So again, yes. So help us to help you to stop the spread and stay home. Cover your cough. Wear your mask. Stay home if you're sick. Wash your hands, as we can continue to emphasize that to the community.
Thank you, Annette. Dr. Ann, thank you.
Thank you.
You done, Dr.
Thanks,
Ann? Anything
ladies.
else? You want to throw out?
No.
No, come on.
Good.
Come on. A little bit more. A little bit more. Come on.
You have Dr. Wen there. You can ask him.
Oh. All right. Let's bring Dr. Wen on. Thanks, Dr. Ann.
Stay safe.
Okay.
Okay. Bye. Yeah, be safe. Ay, ay, ay. Morning, Doc.
Good morning, guys.
Good morning.
Hi.
There's some virtual donuts there if you want. We're celebrating.
Okay. I send my staff over.
Right on. Okay, Doc. So, wow, there's some stuff that happened last night as we have got a bunch of additional easing of restrictions.
Yeah. First, what time did the meeting end last night?
Late.
Late.
7:30, 7:45. So like almost over 2 hours meeting.
Oh.
So it's just a long one.
So it was a long one. So what did you guys talk about? The reopenings?
You know, we opened, like I said from the last time, you know, last weekend we opened just a little bit of time, you know, to make sure that everyone kind of do some adjustment in part of the public and part of public health, in part the hospital. So if we open a little bit of time, we probably can handle it. You know, we probably will not see what happened to the positivity rate probably by the end of this week from the first opening. So you don't want to open a whole bunch. I hear a lot of people say that, hey, how come we don't open daycare, we don't want to school? You know, I know it's almost the same, but again, you know, you can't open everything all at once. You know, so they go a little bit of time, and we see how we do this week.
So can you explain the rationale then behind the daycare versus the schools? Is because we're still in PCOR 1? I mean, is this really even PCOR 1 or what is this? PCOR 1.fun? What? It don't make sense.
Guys, we will. PCOR 1. The reason that we had to be very cautious about it because yes, as you can see, the hospital, they're still in the high 20 range, which is a lot better than before. Okay, we have some nursing staff there for help at GMH. Again, the non-COVID admission at both GMH and GRMC are going up as we expected. That's the second wave after the surge for the COVID. The second wave means the second wave of non-COVID patients. So the hospital are busy. So we're going to stay in PCOR 1 until we feel comfortable that the hospital, at least, that's the most challenging part for us, are comfortable and move forward. And also,
I'm sorry, you said GRMC? There's people, COVID patients at GRMC?
No, I'm talking about the non-COVID.
Oh, okay.
That people have stroke and a heart attack. It's just the regular stuff that we see. Typically after a surge of COVID, we have a second surge, the surge that follow the COVID, which is non-COVID patient. So that's what we see in the first wave, and then we see again on this wave. That's what we expected. So both hospitals are very busy. So I mean, you cannot just go out there and open everything at once. So we have to open kind of slowly to make sure that both hospitals can handle it. What's the difference daycare in the school? School is online right now, and do online at home. But the daycare is important. A lot of essential worker, a lot of company employee that need to stay at home because they don't have the daycare to take care of their kid when they go to work. So they have to prioritize somewhere, and we need to get people back to work. So the daycare be the first one. It's probably take place in front of the school because the school can always open. After the week or two or 2 weeks down the line or something, when everything kind of settled down, we see a kind of plateau, a little bit rise on the case this week. So we hope that it's just a temporary rise and then it's going to back down again slowly. So we see how we have the positive rate by the end of this week. it's a result of last week opening. So
Right.
this is
So,
what
so
happened.
that being said, Doc, I mean, God, and I feel for these businesses, and I understand that the last of the last with the gyms and the daycares have been waiting to reopen. But if you're saying that the surge within the surge that we're seeing this week is because of the openings we did last week, wouldn't it have been more prudent to just stay where we're at for at least another week to kind of monitor it instead of just?
Wait, so you're already able to tell that because of what we reopened last week is the positives we're seeing this week?
No. The positive we see this week is not from the opening last week. It's too early. It's way too early. The positive that we see this week is something different. That's why I sent a message to Chris yesterday to tell people that, hey, if you're sick, really don't go to work, because what I send to Chris is what we see in the clinic. Okay, I mean public health will have to tally on the data, but what we see is that people are getting back to work now, and they still go to work when they're sick. And if you have one person sick at the workplace, and you identify them as positive, the whole workplace had to go through this contact tracing all over again, and then they have to test a close contact in the workforce, and then if the employer do not understand that they send the employee back to work, when the test is pending, and the test come back positive, that's defeat the purpose. So that's a message I want to send to everyone, is that if you are sick, stay home. Don't go to work. Okay. And if a workplace has someone that tests because of close contact, let those employees go home for 24 hours. But the test is very fast. It takes a day to come back, and make sure they're negative before you get the employee back to work. That's very important. And also, if you have a family member that turned positive in that family, that means that the rest of the other family member in that household should also stay home and inform the appropriate employer that, hey, we have a positive person in the family, because the chances you got to observe yourself, because you might have the virus already, and if you go to work, you're gonna the cycle repeat again. So that's where we see the surge now. In addition to the family, just like Annette say, the family still have some small gathering, and that we still have to see a surge in that one.
Right. Yeah. But now you can have a small gathering because it's okay. Doc, stand by real quick. We're KUAM FM in Agotnia, Guam. This is The Breeze on the link. To our viewers on KUAM TV, hi. Está Jos. Come on over to the radio, of course. We're also on our Facebook Live stream. That's what I'm saying, Doc. And let me rephrase the question, since I was so. We reopened, we eased the restrictions, but we haven't seen the positives come down. You're saying that we're seeing an increase, right? Because people are gathering. But what are we doing? We're allowing people to gather, and we're opening more things. So even if we don't have any data from the easing of restrictions that happened last week, would it have been prudent to still stay where we were at and assess our situation?
We relax the gathering, to 5 or 6 people, and it's within the family. And again, we will ask the public in, being compliant with that and be cautious. If you get together within the family itself, if I take my family to the beach by just our family, it's okay. You won't catch anything because people are away from you. But when you have different family that not in the same household get together, that's where the problem starts.
Right.
You can ease out the restriction to 5 or 6, but stay within your family. That's the key.
But that's not what the advisory says, Doc. The executive order says you can congregate and gather up to 5 people.
Mostly is Chris. We like to say stay within your family, and that's a message that it only takes one person in a different family household that is positive and visit your family, and that's all it takes is one incident, and your whole family at risk. So use your judgment. You can't really make it so strict that everyone stay home for several months now. You got to ease up a little bit at a time and trust that the public is aware of the situation already for 5-6 months and take precaution. It's not a big gathering of 5 to 6, but like I said, I highly, highly recommend that you stay with your family household only.
Doc, is there a new plan on reopening or anything like that? Because that might help with a lot of people wondering what the hell's going on. I saw, is it the Chelon Parhe Nemlu, the recovery plan, right? Which established the P Corps, and a lot of the things that we're seeing reopening are under P Corps 2.
Yeah, that's what I meant.
So
the P Corps is out the door. P Corps out the door.
Does the P Corps even matter at this point?
Doesn't mean anything.
The P Corps one, and I think that we have to kind of change the guideline. When we look at, you have 4 criteria there. PAC still try to look at to see, we're gonna not weight the 4 guideline equally. There's some that will weight a lot more than the other. Okay, so that way we don't have, because we stick with the 4 guidelines strictly equally. You never move out P-Corps 1. So we still try to kind of weight the 4 criteria, which one is heavily weight than the other, to see there's a possibility we can move off or not. But the hospital is the one that is the biggest challenge. So we have to get the hospital ready, and we have to do the public contact tracing. Everything had to be very robust before we consider. Those are probably the heaviest weight of them all, of the 4 guidelines, those 2. Last night the meeting was so long just because we really want to make sure that we have a very strong public health ability to do the isolation, quarantine, and contact tracing. That's where we really want to push that. We come up with a lot of metrics that they have to put together, and again, those things we have to have before we feel comfortable to make all the decision of moving forward. But
apparently the decision's we're already moving forward. We are in P Corps 1 point fund.
Yeah, we're moving forward, Sabrina, because we can't really close everything, but you can see when we open the business, everything is very small increment.
I'm just saying, why bother having these triggers in P Corps if we're just gonna do whatever?
That's why people are confused.
And that's fine. Maybe just a little more explanation and some sort of a plan to let us know. Because the plan that we have, it's not.
You come out with a plan and you tell people to pay attention to it, and then you totally pervert it and don't pay attention to it, and then you expect us to get in line and do what we're supposed to do when we're just trying to make sense of. Slow reopening. Are you kidding? We flicked the open switch on pretty much every business except bars in the last 2 weeks.
Yeah, I think that's something that we really try to work PAC and public health, and public health have representative PAC guys. Dr. Magnolia, I know she's no longer public health, but she's still there because she's the valuable asset for us because her experience in public health. Dr. Ann is there, Dr. Ting Hancock is there. And trust me, it's not just a meeting just twice a week with them. We pretty much keep in touch with the director. I'll probably text and email him and talk to him probably 3-4 times a week because when we have questions, we need to get him on board to talk to us. And even when we have a PAC meeting, when we have to make certain decision, public health is there, the whole team. Sometimes we have, director have 15, 20 people on his team on the call.
Oh, wow, because I heard too.
Yeah, we work with them very closely, and the only thing that we try to work together, make sure that we come up with some number, and we still keep pushing that some number should be out to the public, so that way when the physician advisory could make some recommendation that the public understand more about why decisions have been made like that. So that way there's not much confusion out there. So I
Yeah, but
hope
Dr.
that
Ann was just on like a couple minutes ago, and she said, "Oh gosh, the Hawaii's numbers are way better than ours," and here we are.
those numbers, the death rate and the positive rate, everything, we have to release to public somehow, where they're coming from. Okay, that's very important even for the public.
Oh no, I
and
meant
to
the
provide-
numbers in terms of like public health
Yeah.
participating and giving the numbers to the PAG, and if the numbers don't look good, as a PAG really actually listening to public health.
The public health in the PAC, when we make decision there, public health is there, when they have the decision, but remember those decision advisors decision, that's advice, and and those advice go up to the governor and her council and other business group,
Right.
and they take our advice along with the other group, the business side of the house, and they make a decision based on multiple things.
Kind of seems like it's only the business side of the house that really has the ear.
Sometimes, is followed. Sometimes it's not, just because, like I say, it's not just one advice that she have to take into account what she make a decision. But again, there's a whole bunch of the people that give advice also. So it's a matter of balance, and I don't think that any decision anyone make at that level gonna make everyone happy. What I mean? But again,
Right.
I envy her from, and it's hard to be in her place, because you make decision, and then one group is okay, and then a group will say bad thing about it.
Yeah, but you know what, Doc? I don't feel sorry for her, because you know what? If you come on the air, you hold a press conference and just explain your decision.
Yeah.
Then that's fine.
Not hard.
But to not talk about it, not have any sort of dialogue with the media, answer some questions, just to explain it.
It's insane.
Yeah.
Insane.
I don't think that's too much to ask.
Yeah, especially when, Doc, we get public health on before you, and the territorial epidemiologist is saying the numbers are still too high. She's basically saying we're worse off than Hawaii, and it's the governor's call to open the island, and you could just tell. You don't even need to read between the lines. You could tell that they think it's a bad idea.
Yeah, that's the thing, guys. That's what we want. Them to put out a lot more number, right? I hear Dr. Lombard before Dr. Ann did the radio show, but Dr. Lombard, based on what release and have his number and his number look better than the state, but then Dr. Ann say it's worse in the state. So I'm scratching my head. So I say, well, which number is correct? So
Right, yeah.
it's the best to have, public health really provide a much more detailed number, so that way everyone in the community know why decision is made. I don't want to say a number, just like Peter say a number, Dr. Lama say a number, that public health will say something different. So everyone be in the same page. That's why last time meeting is so long, because
Yeah, PAG, please don't put out any kind of projections.
So it's something that we have to be to be straight about, so that way we can understand why we move forward. But again, decision move forward, we take into a lot of consideration, and it's very slow. Like I said, a lot of people are still not happy that some is still not open, but again, they wait everything and make sure that we open the limit at a time. And again, just like your question, daycare, what's different daycare and school? the school's online right now, so we can wait a little bit. But daycare is essential.
Right.
Other people go back.
It's
So
essential? Did you
those-
say it was essential?
Daycare, yeah.
Which one, Sabrina?
Daycare is essential.
Yeah, I mean, Sabrina, I still have staff that cannot go to work because they stuck at home. There's a lot of nursing staff that cannot go to work because they have to take care of their kids.
Yeah.
I'm sure every company in Guam have a lot of people that work at home, which is not that productive because they can't put their kid in daycare.
No, I agree with you. They're essential.
Yeah, no, I what's more
Yeah.
essential though, a tattoo parlor or a daycare?
Yeah, that's part where the service and is a very low number, and those like the tattoo parlor is a very low number, Chris, rather than the daycare.
Right.
Daycare, we have to make sure that the daycare worker are safe, and they need to take the precaution, protect the kids, and that's something that they think they have a very, very, very good system, minimize any risk in the daycare, and we're very comfortable with daycare people and open a daycare to make sure that the kids are safe and the parents can be able to go back to work. So, to me, daycare is very essential. We pushed that issue for a long time, and it's finally open. So we are very happy that they did. So.
Right on, Doc.
Any final comments for people out there wondering what to do?
The final comment is, the governor relaxed a few the beach, all that kind of stuff in the gathering, but we really ask the public, really, we all should know already, just stay within your family, okay? And if you have someone else there, just be careful, okay? Wear your mask and just follow the guideline, because we need everyone to follow the same thing for this curve to go down, okay? And again, we're gonna learn to live with this virus, and we're gonna need everybody to help us beat this thing. So please just follow and the guideline, and again, we're looking forward. If the numbers look good, we'll open more business, but again, slowly, okay?
Right on. Learn to live with the virus, but if you die from it, don't worry, you get 10 grand. Your family gets 10 grand.
No. You hear my speech on dying of the virus. It's very sensitive.
I know.
We don't need to do more people. I tell you, those people with comorbidity, they can live a much longer lifetime with this
we get it.
COVID-19 tech. So, we have to kind of feel very sensitive to those families that lost their loved one there. Okay.
Of course.
So, okay. Any other question, guys?
Anything else discussed that we should know about?
When are you going to open the bars? There you go. You're going to open the bars. What is that for next week? That's the only thing left. These bar owners are so pissed.
And I know there was a question on here. No dine-in. No dine-in.
Nothing on dine-in, Doc?
We're going to push the dining. I miss eating out. So,
you can eat out just outside.
Yeah. You can literally eat out outside. In the hot sun, Doc. Yeah. With the mosquitoes. I did a whole thing on my Instagram. You can eat outside, but you better bring 5 packs of mosquito coil, 3 cans of off, 4 coconut husk, and DDT. Thank you, Doc.
But hopefully, okay. Like get the flu shot, don't get sick, okay?
Yeah.
Okay.
Thank you, Doc.
Have a good day, guys.
You too,
Okay,
Doc.
bye-bye.
There you go.
Have
Right
a good
on.
weekend.
8:19. We're coming back with the Legislative Health Chair, Senator Teresa Lahi, next on the link. It's 8:20 Friday. Good morning.
Alugun belid lan taxi
When the world feels stuck at home, there are people who would love nothing more than to have a home. Disasters don't stop during a pandemic. Together, we continue to give help and hope to those in need. Help now at redcross.org.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
What is Guam COVID Alert? It's a community of people who care about the safety of others during these unprecedented times. It's thanks to the PathCheck Foundation of over 1,000 volunteers collaborating from all over the world to create a unified solution. It's Apple and Google partnering up to develop a Privacy by Design app that uses randomized Bluetooth keys instead of identifying information to send notifications of exposures to others. It's PathCheck, Google, and Apple's marketing teams providing marketing toolkits to ensure Guam has all the possible resources to make this effort a success. It's the Governor's Office, Public Health, and the Office of Technology uniting with all these experts to find a solution to help slow the spread of COVID-19 on Guam. It's all of these things coming together for one simple thing: to protect our neighbors, brothers, sisters, and all the people of Guam, especially during these times of uncertainty. Help Guam stop COVID. Add your phone to the COVID fight. For more information, visit guamcovidalert.guam.gov.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
We got your 6
at 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. Good morning, 8:27. It's Friday, yep. The second day of October. Let's go back to the KUAM News Zoom room where, to be a fly on the wall in the KUAM News Zoom room during commercial break on the link. That's where the real action happens. We have the Legislative Health Chair, Senator Therese Terlahi. Good morning, Senator.
Buenas. Good morning, Chris, Sabrina, and Jason. Good morning.
Right on. I guess, and we'll just jump right in this conversation, and we'll get to the oversight hearing, of course, because it's huge. The conversation we're having this morning about the executive order that came out last night mandating more businesses and to reopen and easing of more restrictions, coming at a time when we just had public health on an hour ago. The state epidemiologist said that the cases are still high, that we're doing worse than Hawaii, and that, basically when we asked her, should we be able to open now with what's going on? She said, it's the governor's call. In a public health emergency, I mean, it is the gov's call, but we just want to get your take on all of these developments, Senator.
Well, thanks, Chris. Yeah, that's pretty much the same that we heard yesterday at our public hearing. It's that they are still very concerned, of course, with the number of cases and the hospital's capacity. But they told us it's the governor's call. And so I was a little surprised to hear that. I was expecting public health to have a more, the more influence of, in this public health emergency. That's the way our statute is written. Although I understand the governor has the authority to write the executive orders and to order things open or close. So, but, I think it's a balancing act. And so there were some good things, of course, that public health has definitely improved its tracing capacity. And I'm very happy for that. That was it's always been critical. So even since May, we've been asking them, is your tracing capacity capable of, tracking if we open up? That was when we were contemplating opening up back then. And they said yes, but then they became overwhelmed. And so, we were very confused. How could that happen? And so now they're assuring us that they are able to trace, they're able to contact people, first of all, within 30 minutes of a test. They are able to inform close contacts, family, the whole household within 5 to 8 hours, make sure that they get advice as to quarantine. They're able to, advise those positives that they need to get into isolation. So all of this within 5 to 8 hours now. And if you remember the last hearing, we were talking about days, and it was even taking in some cases longer than that because of they were overwhelmed. So very glad to hear this. They've increased the number of people that are working on this. So the more we have to trace and test, the more I think we will be able to open. That's the key. That's what we keep saying for our tourism industry. We're going to allow visitors if we're able to test them and we're able to trace them. So this increased capacity is great. And they've got some backup capacity also. And they're still building it. So they're using federal money to continue to hire more people and to build that capacity. The things that were not as satisfactory were, as I think you discussed with public health this morning, and that is, we're still hearing that, the biggest part of the spread of the virus is a community. They call it community spread, community contact, and we can't get the data as to what they mean by community contact. It includes, every activity, and so we've asked them for months to detail that activity. And I feel like if we could detail that activity or what is creating the risk, then we would be able to convince the public as to, to respond appropriately. And all of this is a very delicate balance in trust, I think, so we've asked the public to do things based on, our recommendation. Please sign up for this app. If we can get 60% to sign up, it's going to help our community to open up. But we haven't been able to get 60% yet. And so that's disappointing, and it doesn't make us confident, So we need all of these things to work together. We need, people to sign up for the app. We need details on this community contact. They said yesterday at the hearing that it would not be ready for maybe a month. And I just cannot understand that part, because I'm so confused as to how these decisions are being made if they do not have this data presented, to the public, to the physicians advisory group, to anyone who's making the decisions. That's how I want the decisions to be made, is based on data.
So having said that, do you know how these decisions are being made? Was it expressed last night how the decisions are being made? Did anybody say, if we don't have the data?
They said they attend. You heard that Dr. Ann. She attends the physicians advisory group. She gives them what she knows, and she says it's up to the governor. The governor makes the decision. So I think the physicians advisory group also says that they've made recommendations to the governor, and I know that we all want to open businesses. Of course, that's the goal, right? We want people to get back to work, especially we want them to get back to as normal a life as they can. But we all know we have to do this differently. We have to do it safely. And so that's why, even with opening, we have to have data. We just have to. We have to know that these decisions are being made logically, and that we can use the data to convince everyone. It's hard to convince people to stay away from the beach if we're saying the spread occurred at a bar. You know what I mean? So that's why I want to be able to tell people it's been proven. The funerals, even with the rules, if that was the case, that even with the rules, those rules were not sufficient to protect people at funerals spreading this virus. And so the other from the Division of Environmental, they're working very hard. They are the ones doing the guidelines for these businesses. The businesses have been great. They've been writing their own guidelines in a lot of cases. The GHRA has helped write guidelines. The Women's Chamber of Commerce has helped write guidelines for businesses so that prevent these public health and get their businesses approved for opening. But the Division of Environmental Health, who's charged to enforce these new guidelines, has not increased its staff yet. So we urged Linda Dorsey, when she was the director, to apply for additional money to get additional inspectors at the division. And she did apply, and finally, before last hearing, that was approved. But today we found out they haven't received the money. They haven't hired in that area yet. They've got that money, the $3 million of extra money that they will be getting, and they've got the federal money because of COVID that they're supposed to be using to shore up this capacity. But the hiring seems to be taking a while.
Senator, let's just put on our GMH hat just really quick, and the idea seems to be that we're gonna do these gradual reopenings. And we're going to allow for more easing of restrictions because the hospital's at a place where it's acceptable now, right? Like the number of people with the hospital, because the hospitalizations was a key part of us staying in PCOR 1 or us getting out of PCOR 1. And so, yeah, they've kind of gone down, but I've been talking with Lillian, part of that's because a lot of people are dying, like one person's dying every day, right? So do you feel that GMH is in a good enough position, like stabilized, right, so we can move forward with the easing of restrictions and reopening of things?
I've heard your interviews with Lynn. It certainly does not sound like it. Of course, it's GMH Public Health. They are our heroes, because no matter what comes their way, they're going to do it. They're going to do it. They're going to persevere, and they're going to take care of it. And they've taken this very seriously, and so I really want to commend them for this. These are really dedicated employees. We hear it from her. No, she's begging us to stay home. Do not spread this anymore, because you're putting everybody at risk, and because of their capacity. So I'm not sure that the hospital capacity significantly improved. I think it may, and you see that Chris, it changes on it, so it's a little too early to tell that it's changed enough where we can be comfortable. I'm not comfortable.
Yeah, I'm not comfortable,
So
but
I
only
think
only because mostly we have public health on, and public health is pretty much doom and gloom, and then we have GMH on, and GMH is pretty much like, hey, stay home, everybody, don't go anywhere. But then we have the governor's like, yeah, we'll go to the beach, go gather, congregate, and so it's just a little confusing with the mixed messaging, especially when it's kind of life or death, you know. Connection.
Well, I'm sorry, these public health representatives on your show, Reggie, and that you have GMH on regularly, because I believe that hearing from them directly more often helps the public. That's the only place they're going to get that message right now, right? That they're going to hear directly that, no, we are in high risk still, and we are very concerned. And when you hear the hospital director saying we are very, very concerned, causes all of us to be concerned. So I think that's effective, and I want to thank you for continuing to do that. I that's what helps people, change their behavior. I think they need to hear that.
Is there anything
that's their.
Is there anything the legislature can do to have Adelup or their chief of staff, whoever, to come down, just kind of explain the decisions that are being made, and the provide the data in which the decisions are being made? I want to say early on there were like these informational briefings and things like that. Is that something that the legislature can do today, so we kind of have a better idea about these decisions and these executive orders that are coming down? I mean, if we're confused, I can imagine maybe the legislature might be a little bit, or, some of them might be getting the inside scoop before everybody else.
Oh, I don't think so. For example, we were not aware of this new executive order when we had the public hearing yesterday. Otherwise, of course, I would have asked public health more about it. Like, what part of this do you support or not support, or, have concerns about? Mm-hmm. And what data supports this? I would have asked them that straight out, and I've asked them that on many occasions. What data supports this or that? This opening and that not opening, but they continue to tell me they're unable to share the data. And at first they thought they were not allowed, but I think now that they've got guidance from the Attorney General, they know they're allowed if it's related to tracing efforts and if it will help them with their investigation. And they've promised since our last hearing on September 8th, I think it was, that they were going to give us this more detailed information, especially, for example, what constitutes community contact, but they're not ready. Now they're saying a month, and I that's just too long. So anyways, we do.
So how many more people have to die before we can get the data, basically?
Yeah. So a couple times, I asked Dr. Cabrera to brief me, and then I invited all the senators to join us to be briefed by him. But they want this information to be private, and it's very difficult for us to go out there and say, this is what we know, and this is why you should do this if it's designated, private. So we've of course asked them and encouraged them, and I've asked to be part of the physicians advisory group. So at least as the health chair, I could understand all the different concerns that are on the table, and then maybe, I could do what I could to support those concerns, or to convince people that, the logic behind all of it. And but I think, we're
what was the response?
Yeah, what did they say? What did they say when you asked, Senator? I'm curious. Who told you no?
Oh, they said no.
Who?
They said no. We want to be able to discuss this privately without any. That's what they said.
Without any pesky senators.
Yes, I guess. But the speaker has set up weekly meetings with the surgeon cell. So, there's different groups here. We've got the surgeon cell, we've got the physicians advisory group, we've got public health, and you've got the economic group, right, that advises the governor. So the speaker has set up meetings with the surgeon cell,
Is that open to you as the healthcare oversight?
She's
So you're able to.
She's invited all of us. Yeah. So this is with Dr. Mike Cruz, but pretty much, yeah, we're seeing, the charts that they show during the press conferences, and we are allowed to ask some questions. So those are helpful, but
So you're saying he's not giving the data?
The information is not in advance like you think. Like it's just pretty much same time as what we're doing with what the governor's been doing for press conferences. So I guess things change, quite often. I would prefer to see these type of briefings public as much as possible and as often as possible. I just think the people of Guam, they still, trust the doctors, and they would like to hear from them. They want to hear the why. We need to be united in this. I think you all agree, and I agree. We need to be united, and so if we can all understand the why at the same time, we can act together. It has to be at the same time.
Yeah, you lost me at United.
Yeah.
Well, I'm just saying we want our community to act together. If you look at the successful countries, I think that's what they cite. They cite that, everybody is willing and very willing, and they trust the government, and they're willing to do what the government has asked them to do. That is key.
Yeah.
We want our people to trust and do what the government is asking them to do. If that's going to help us get out of this faster, then that's what we need to build that, and we need them to do that.
Yeah.
For one, I'm willing to do whatever I can to convince people to stay home. I'm very concerned about the death rate. I've known so many of these people that have passed away, and it's like we said in the very beginning, even one is too many, right? And what we're seeing now, very young people. I mean, it's heartbreaking, but that's an understatement, right? It's kind of like I'm willing to do anything to protect these people, and so sometimes it reminds me of these court cases. We set the court system up so we've got the prosecutors and the defense lawyers, and we pay for defense lawyers if they can't, and we want the system to argue with to be balanced so that both sides get to present this information, and then the decision maker is going to make a decision. And so sometimes I see that to be very similar here. Businesses who want to open, arguing to open businesses that they're very safe and they're going to comply with guidelines. And I think they have done an excellent job for the most part in complying with the guidelines. Mm-hmm. The ones that haven't, I'd like to learn the details of those and see the plan for that, without an increase in investigators at the Division of Environmental Health or the inspectors. Mm-hmm. I worry a little bit about that.
And we know that the Division of Environmental Health are out there doing these inspections because we get them. We get that they're doing their COVID-19 inspections and they're doing their sanitary inspections. And it's not just like 5, it's like 40, 50 places that they're going out and inspecting. So kudos to Tom and his team.
They work really hard. Tom has an excellent team, and they work very hard. But I just think if we're talking about opening, then, and everybody's operating under new guidelines. Yeah. Everyone.
Yeah.
So,
and it's all the more reason, right, that everybody, if you're going to go out, you have to don't let your guard down because it has this trickling effect.
Yes. That's why the director did apply for additional money from the governor from that $117 million so that she could hire more inspectors.
Right.
That was part of the plan.
Well, Senator, closing thoughts here?
I just want all this in place.
Right.
Yeah.
Oh, well, I want to, public health's doing they're working very hard. They still are. They're increasing their capacity. I'm very happy for that. I still, we're pushing them to get the data out. I think we need to know what data is being presented to the Physicians Advisory Group, what data is being presented to the governor. I think that's going to help us, understand the logic and convince more people that it makes sense. It's simple as that. It's if we all, I've always said this about actually for everything, not just the pandemic, but the more the people know, the more we're going to be on the same page, and the more, you know, we don't have to fight about it. It's very clear. We understand. And so that's the goal for me. So that's what I'm hoping we're going to do with public health, is get the data out. I hope I'm going to continue to call them, and if we can send some help, do whatever we can to get that data out sooner. They've got help from Department of Labor, entry clerks, they said, entering some of this data. So hopefully they can get it out sooner than a month. We want the decisions to be based on that. So I just can't see how we're going to wait 1 month for it.
Right. Yeah.
And but otherwise, yeah, I'm still very concerned. I think the community should still act concerned. No matter what opens, they should act concerned. They should take care of themselves, their families, by, you know, doing what they've recommended: the mask, the social distancing, and we've got to be strict about it. We've got to develop a new culture of that being, you know, ways to show our love despite, you know, social distancing, and our friendships despite social distancing. I'll tell you, you know, it's hard. We got a campaign going on, and I see your next guest here on the Zoom. And you know, we were down in Maritza on the weekend, and it's new, and you know, we wave from far away. We you know, we just make symbols and different things because we want to keep everybody safe. So I just want to continue to encourage that.
There you go. Yeah, a whole lot less handshaking going on in this campaign. That's for sure, if any. No, but people still don't.
Out of love, and I hope everybody understands. Yes, that is you know, an act of love is to just keep your distance, because this is the thing that I think is a little confusing too. They say, you know, people with symptoms should not go to work. However, they continue to tell us those without symptoms are the ones that they're spreading this actively. They know that. Yeah. And so that's the very difficult part of this decision making, that, you know, that's very difficult. I think even for the doctors, it's like, we know there are asymptomatic people who are spreading this disease, and how do we control that?
And they won't do it. I mean, a temperature check at the entrance to anywhere won't detect an asymptomatic person at all.
Right. Yeah. It doesn't at all. Yeah. Nothing does.
Right. Yeah. Thank you, Senator.
Thank you. Thank you. And have a great day.
You too. Be safe. Wash your hands.
You too.
Okay.
I will.
Okay. Good morning. 8:50. We're taking a really quick break, and we're coming back with candidates here for Congress, Republican Will Castro and Democrat Robert Underwood. On the link, it's The Breeze 93.9.
Make it through the week.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
We got your 6
at 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information
What are the
you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. Hey! 8:53. Good morning. Let's go to the KUAM News Zoom room where we standing by here. Senator Will Castro, candidate for Congress, and former Congressman Robert Underwood. Good morning. I hope it smells like Clorox wipes in there as we had our sanitizing duendes all over the KUAM News Zoom room. Good morning.
Hello.
Good morning. Buenos dias.
Let's just jump right into it, guys. And this is kind of a little off topic, but totally on topic for this morning anyway. What do you guys make of this latest executive order and the decision to ease more restrictions and allow more businesses to reopen while we're also seeing this surge of positive cases? Go ahead.
Congressman?
Yeah.
Well, yeah, I think Senator Terlahi's assessment was pretty good. Is that actually the more information we have, maybe the more understanding we'd have of it, and what seems to be not well connected could probably be better connected. And that's really it's always accurate information that really resolves a lot of doubts and concerns. And I think the more information we get, the more understanding we have of it. It doesn't seem well connected, but maybe there's a logic behind it, and maybe there's a reasoning behind it. And so the more information we'd have, the better opportunity we'd have to understand it.
Accurate information. That's my favorite kind of information.
That's right. Yeah. And, I'm going to talk about accurate information.
Woo!
Okay, Will. Let's go, Will. Senator Will.
Chris, I sound like a broken record. We're in the second trimester of the coronavirus, okay? And back in March and April, I said two things, and it didn't take a scholar to say this. First, use the planning mechanism that worked in the past. I offered the civilian military task force as a great example for a whole of government approach to get us. This is not just about the virus, and clearly they're seeing that now. The second issue is get the first line of defense and people who are able to talk to us. That would be the mayors. And at the time, because it was fresh, the initial PCOR 1 lockdown was fresh, my son was still engaged in sports and those discussions. Get with the coaches and other community leaders. So that's one part. Then I went on record in writing to ask for that additional data before we start using this mobile app. I mean, you can send it to the university, they can do cross tabulations, and I know public health is now collecting that data. But I look at it at the reverse engineering. Why is it that you're locking the rest of us down? And then there's MilCon going on. And we know the greatest proliferation of the virus initially came from military personnel and civilian military contractors, at least the construction side. We know this for a fact. It's not hyperbole. And so with that known, what else can we do to allow the people to go back to work? Because while one person is afraid to contract the virus, another family can't even feed themselves. And so I think the data discussion is long overdue. We've had the discussion. They just need to act on it. And more people need to be a part of it other than the physicians, to be frank with you. Get the sociologists and the scholars and the Bureau of Planning involved to look at this. I don't know. They don't have to recreate the wheel. There's a planning mechanism in place.
Yeah, thanks for pointing that out.
Yeah, it's a common topic here on the show during commercial break. Yeah.
And so let's just go ahead and dive right into this. We really gonna be getting $3 billion?
Yeah, those. So let me just.
Wow.
Let me preface this.
What did you say? Direct deposit, $3 billion?
Well, it's really. I tried to listen to. Of course, I was having my own press conference while Congressman St. Nicholas was suddenly had his. And the question was, that press conference is talking about a deal that hasn't yet matured. And of course, as we speak, we don't really know whether that, I hope that there's some kind of compromise between the White House and Speaker Pelosi. But if there is a compromise, it will be far less than that $3 billion that was discussed. So I believe, and I really want to say this clearly, that it was irresponsible on the part of Congressman Mike St. Nicholas to talk about a package that is not yet done. It is irresponsible because it is conveying, it really is taking advantage of our anxieties and our concerns and giving us a sense of false hope. Even going into that news conference, you must have known that whatever package would be resolved would be far less than what he was talking about. And so that's the essence of that. The responsibility of a public official, and that's what we were just talking about, is to tell the truth, to be honest with people, to tell them what is actually going on, not to convey a sense that, don't worry, I've got a bunch of things here that we're working on, and then knowing full well that those things were not really going to happen. And as we speak, it doesn't look like it's going to happen. I hope that something happens. I really do, because Guam needs the relief. And then the obvious difference between what Delegate Sablan did in the Northern Marianas and what Delegate St. Nicholas did from Guam. Delegate Sablan did a press release that announced what he was able to put into that legislation that was CNMI specific. Delegate St. Nicholas cannot point to a single provision of that bill that is Guam specific. It is entirely a general bill. There's no specific Guam package. And as a consequence, the difference is really clear. And in addition to that, Delegate Sablan was able to get those provisions into the House bill while still being in Saipan. Imagine that. He was able to have the relationships with the House leadership to manage that process. And in the meantime, of course, Delegate St. Nicholas has not seen me or Will personally since February.
Senator Will?
Yeah, thank you, Congressman. I always appreciate your insight. The key takeaway for me from the incumbent, is clearly in the lack of his communication directly with the Speaker of the Guam Legislature and the Governor of Guam herself. I found it pretty curious that there was no reference to even the Democrat Party, but that's okay. I'm not complaining about that part, Congressman. I just find it curious that you would find the expression to represent your thoughts on a particular measure that may not be accurately reflective of the territory's priorities. For example, speaking, to use your word, Congressman, prematurely on the dedication of certain monies for a new hospital. What that does is it puts to the back of the conversation all the options that were laid on the table in terms of how to deal with the GMH issue, the Z-Wing, hybrid opportunities with GRMC and so forth. So my point would be, we cannot achieve, as Senator Talahi had mentioned, one Guam approach if you're having a conversation with yourself and your staff. And I certainly hope that should you prevail, or should I be given the privilege to serve, that we keep open those lines of communication. And I agree with you. I've always said this, and I'm glad we're reinforcing this together, that strong regional partnerships are the key to leveraging additional resources for the territory and the Commonwealth. Congressman Kilili, but also Governor Torres. Governor Torres' reach into the White House and what they're able to do, because they have one common voice in terms of their agenda for the Commonwealth.
Amen.
I certainly hope and pray that whoever wins on November 4th, after it's announced, that we have that one Guam approach, regardless of your individual biases, partisanship, or otherwise.
Amen. I think that's so key. So key. I mean, imagine a perfect world where you would have a press conference and you would have like a congressman and a governor and maybe a speaker or senators together presenting on things. You know what's that saying? Promise the moon.
Well, he not only promised the moon, he's really exploiting the anxiety of people, because we're all concerned about our future. And he, in that press conference, he outlined a series of initiatives which intuitively, or even anyone who's paying attention to the process, knows that wasn't going to be the end result, even if the Speaker and the White House came to an agreement. It was going to come down significantly. And they're still in conversation. I hope something happens, but reducing that, just like Senator Castro pointed out, the whole notion of building a hospital, the whole idea of federal funds for to assist with the pandemic, and this is a general principle, and I'm sure anyone who works at this knows this, that the federal government doesn't supplant local responsibilities, it assists with local responsibilities. It supplements. And this is not a capital improvement bill. This is a bill designed to help the hospital if they need it in reference to the coronavirus pandemic, not as a vehicle through which to build a whole new hospital. It's just mind-boggling that a sitting public official would just simply go and speak this way and not speak to local leaders, not speak to local experts, not speak and not communicate with them. And, you know, in reference to this, information, accurate information, as you pointed out, Chris, is the necessary ingredient of determining positive public policy.
You know, I thought it was interesting because I feel like he did a similar press conference a few months ago when the HEROES Act was introduced, and he made, I think, similar promises, and I felt like I was watching the same press conference. But let me riddle you guys this. Let me play devil's advocate here. What would you say to those people who would say, oh, well, Robert Underwood, if you were the delegate, or, you know, Will Castro, if you were the delegate, you would do the same thing. You would come out in the, you know, month before the election and say, hey, there's this great bill, and if it passes, we're going to get all this stuff. You're going to get $6 billion. You're going to get $6 billion direct deposit. Don't worry. It happened yesterday. Check your account.
Congressman, you want to defend your record? I'll come in after you, or I could go first.
You don't want none of this, Will?
Obviously, that's something that, the whole idea of being honest and have integrity is to not really just exaggerate anything. And again, I just want to point out that the obvious contrast between what Delegate Sablan did and Delegate San Nicolas did is that Delegate Sablan talked about what he did in the bill. Delegate San Nicolas simply read the bill that, as I understand it, he hasn't even co-sponsored. And that same bill is the bill that he had talked about, a couple of months ago as a reason why he needed to stay back in order to massage the bill, in order to work the bill. But in reality, those negotiations, those conversations are carried out, directly between Speaker Pelosi and representatives of the White House. No, it's the responsibility of public officials to always tell the truth. And all we, and of course, that press conference was full of might, could, and then relying on a series of anxieties that we all have. We certainly hope that many of these things come to pass, but you wait until at least the bill is passed in the House, and it still hasn't even passed in the House, although I understand they might be voting on it tonight. So
Will?
that's and it has, whatever passes in the House has no chance in the Senate. That's the other element of this.
Yeah, and so, you know, Congressman Underwood, to your credit, one of the fondest memories I have when you serve, you're always addressing the people. So I'm gonna take a page out of your book if I have the privilege to serve. But I think, you know, Chris, at the end of the day, the people just want an update. Whether you're making incremental steps forward or no steps forward, at least you're coming in periodically, keeping them informed. I find it very curious that you would weigh in at the 11th hour, 3 weeks, 4 weeks out from the general election, to report as if this is something, you know, something that just came out and it's revelational. And I'm not questioning his motive. What I am questioning is the leadership style. And I've always put that on the table. I find it curious that you'll mention just restaurants. I met with a restaurant owner. He has 7 establishments, and for which I haven't received. I should have asked him for some fundraising money. But my point would be, there are other industries here that are crippled and on both knees. The automotive, the motorcycle distributorship industry, they're on both knees. Our tourism industry, obviously. So where's the conversation about directing some of those federal funds to at least even try in a very closed economy, a specific area like Guam? So I have no problems with you making announcements and reporting periodically on what's going on, but I have a problem when you do it to your individual benefit to advance your campaign and give the pretense that, in fact, you're the responsible person for that. And by the way, Congressman Underwood, I found it curious, too. I think you're right that it would have a tough time passing the Senate because there are no, as I saw, Republican co-sponsors in the House bill. So that's something I would have done as a Republican candidate if I get the privilege to serve, to walk it through and parlay the differences of opinion and how we can come to a compromise. So at least try. And I would work with you, the Democrats, as well. I wouldn't just isolate the Republican Party of Guam. I'd work with our governor and our speaker and our future speakers, whoever they may be, on a bill that makes sense for the people of Guam. Yeah.
All right. Before we let you guys go, just real quick, presidential debate. Just wanted to get your take. We'll start with you, Robert.
Well, it was a mess. The debate was a mess because, you know, one guy kept interrupting the other guy. And so the commander-in-chief of interruption was able to look like he was a strong candidate for to some people. But I think to most people who were watching it, they thought, well, this was not the way to conduct a debate. But I do want, and Senator Will Castro is here as well, I do want to have debates. I personally want to have debates, and I want to have the opportunity to have debates in the coming weeks. The people of Guam need to compare and contrast and see what the ideas and the ideals are of the candidates, and see what they bring to the table. And I think a debate, 1, 2, 3 debates, help provide that opportunity. We'll see what happens in the next couple of debates, but obviously, the president kept interrupting the vice president. The vice president interrupted a couple of times too, but not clearly as much. He jumped on the bed once or twice, while the other guy was jumping on the bed all the time. And to use your reference.
Right on. Oh, thanks, Senator Will.
In a nutshell, it was unusual to say the least. It was a lesson for me in terms of stylistic differences. I was able to pull away some policy positions on this. I do welcome, and I put it out publicly, I welcome the congressman, former congressman, and the incumbent to an open discussion at Swamp Road or Humatag Bay to have those differences of opinion. Although I will say, if it's just a Congressman Underwood and I, that it's going to be a love fest because I actually appreciate these healthy exchange and we'll treat it well. But I do want to say, I want to encourage people to look at the long view of the record I want to say, and I'm sure you share the same sentiment, Congressman, that we absolutely denounce and repudiate any systemic racism, any marginal treatment of all peoples. I'll give you a great example to bring it home. The marginal treatment of Chamorros and self-determination over a period of hundreds of years. That's a form of systemic and structural racism and marginalization. So to that, I say as a Republican, I denounce that. And I look forward to a healthy debate and discussion, Congressman Underwood. I have some words about Mr. Biden as well, but I'll spare the criticism. And I want to say
why though? Come on.
Biden, my gosh, if it's true that he had an earpiece, listen, Mr. Biden is just as guilty as interrupting Mr. Trump. And I tell you, it's the pot calling the kettle black. And that's why Dr. Underwood and I, when we exchange, I always defer to this. But I'm not going to criticize the president. I think he's still strong on defense of the economy. He has an unchallenged record and the lowest unemployment record. And it wasn't fair, Mr. Biden, to say under President Trump, he handed us a broken economy. Of course it is. Look at ours. But that's not Luliangro's fault alone, is it? Right? You can thank the pandemic. It's how we get out of it that's going to really sing our praises as a community. And so I look forward to a healthy discussion with my colleague here, Dr. Underwood. And I encourage Mr. St. Nicholas to come home and be with the people, be with the community, and let's have a discussion on how your record is different than Dr. Underwood's and how my record as a legislator in the Guam legislature is different from both of you, because I have some differences in terms of how to handle the pandemic from a federal congressional perspective, in terms of the economy, and they're kind of interlinked, aren't they? So I want to have that discussion, and not on Zoom. I want to be able to look at these two gentlemen in the eye, and right there on Yamatic Bay with the rest of the people of Guam listening in. Thank you. I look forward to it. And God bless you.
A congressional debate.
I will take that picture with you in Manila.
Thank you. Thank you, Robert. Thank you, guys.
Stay safe.
Thank you. Thank
Wash
you
your
so
hands.
much. Have a great day.
I want to be
Have an honest day.
right. I want to be accurate today because it's Friday. Okay, see you guys. So, wow, wouldn't that be something? A congressional debate on the shores of Yamatic Bay because the beaches are open.
Only 5 people would be allowed to attend. That's, we'd be the camera crew. So
And it was me, you, and the 3 candidates. Or I want to see some congressional debates. That's going to be fun. It's going to be exciting, right? Especially like a 3, because there's no primary. It's just 3 guys.
Do you imagine if we actually did have 3? Can you picture 3?
I would love it.
Do you think we would actually have 3?
Well, I just don't. I just don't really get it. Just debate the guys. Okay.
Can't even have a freaking forum.
Yeah, nuts. Again, I know that
over Zoom.
Congressman St. Nicholas definitely has some fans who follow our show here, and we just implore that you reach out to the delegate and ask him to just come on. We've repeatedly asked him. We repeatedly put out the invites for him to come on via Zoom.
No, I got to say, though, I appreciate him for allowing us into that press conference because Nestor got the invitation, and I just asked him, hey, can you share me the link? And then I jumped in.
Yeah.
So, I got to watch a little bit of it. But
he let us into a press conference in the month before the election. It is what it is. You know what I mean? 9:15. So we'll take a short break and get out and vote. Yes, you can. We're going to come back with the Guam Election Commission and tell you exactly how you can cast your vote for. I'm more of an against voter myself with the Guam Election Commission. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
Our frontliners have been working tirelessly to keep us safe, and now they need your help to get our island back up and running as safely as possible. Did you know your smartphone can be one of the most powerful tools in our fights against COVID-19? That's why we're bringing you the Guam COVID Alert Exposure Notification app. This app works by letting you know if you've been exposed to someone who's positive. It's completely voluntary, and more importantly, it's completely anonymous. It does not track who you are or your location. Researchers at Oxford University have found that for every 100 to 200 downloads of the app, it can prevent 100 infections and save one life. Add your phone to the COVID fight by going to guamcovidalert.guam.gov or download it from the App Store or Google Play now. Help Guam stop COVID-19.
We got your 6.
At 6 a.m. with the link on Breeze 93.9 FM. Bree and I connect you with all the latest news and information you need to know to start your day.
Then check back with Guam's news leader at 6 p.m. for the day's top headlines with KUAM News Primetime.
From 6 a.m. to 6 p.m. and everything else in between with KUAM Digital, we got your 6. What up, Jake? We can get a J cam? 9:20. Good morning. It's Friday. Friday. Woo! Executive order came out last night, Bree.
Sure did.
Where's that?
Do you want to know what's open?
Yeah. Everything except the bars. Isn't it easier to say what's
There's
open?
no dine-in.
Yeah, no dine-in, no bars.
Right. So starting tomorrow morning, let's see, 8 a.m. Saturday, social gatherings and congregations of no more than 5 people will be allowed. Religious services can resume at 25% occupancy. All Gov Guam parks, beaches, and pools will reopen, but limited to 5 people per group. Gyms, fitness centers, and dance studios are allowed to reopen, but at no more than 25% capacity. Then on Monday, eligible child care centers will be allowed to reopen, and sports organizations may request authorization to conduct non-contact training at their designated training facilities. And so decisions will be made on a case-by-case basis with respect to that.
Right on. 9:20. Let's go to the KUAM News Zoom room, where the Guam Election Commission's Miss Maria Pangilinan is standing by a day with her Fiesta Friday mask.
And it's coordinating.
A day. Oh, also, yeah,
Go Bonita.
Senior
right?
centers and bingo is not allowed, and no schools.
Right.
Okay. Hi, Miss Maria.
Half a day.
Election is still allowed.
Yes, it is.
Hey.
Hey, who's that?
Irresponsible. Irresponsible, and then also.
Oh, yeah. Someone's mic needs to get muted. Okay. So, Miss Maria, can tell us if someone's waking up this morning and they want to go vote, what's the process today?
If they want to come and vote today, they're welcome to call 477-9791. will pre-fill their application form. It will save them some time, and we will let them know what time is best to come. If they were passing by and they thought, oh, I want to come and vote, we won't turn you away. Just proceed up to the 3rd floor after you get screened downstairs. We will fill out the application form upstairs and even at curbside.
And as for tomorrow, though, you guys have an event going on, even if it's raining, right?
Yes, we're ready to serve the voters in the central part of the island over at George Washington High School in Manila. We will be there we will start serving our voters at 9 o'clock a.m. and we will be there until 4 o'clock p.m. We will be serving on a first come, first served basis, no appointments required. We are ready to serve all the people of Guam. Anybody can come and register and or vote. If you're from Malesu, if you're from Jigo, if you're from Dedido or Umatak, you're welcome to come down if you missed us in Malesu or here at GCIC. 9 o'clock to 4 o'clock, bring your ID, wear your mask, bring a black or blue pen, vote early, vote safe, Viva Guam.
Viva Guam! Viva CNMI! Viva Chamorro!
What was the turnout for this past weekend in Mauricio? What was the turnout like?
We had over 400 voters show up in Malesu. We hope to beat that this weekend because the villages close to us in Manila itself is more populated. So we want to see the voters there. But, we're open today. There's nobody upstairs on the 3rd floor. Please come and vote. I'm encouraging, the Guam Election Commission is encouraging our employers to bring down your employees, take a picture of everybody with the I voted sticker.
When we talked to you last time, you mentioned that you were going to try and get food trucks and things like that over in Mauricio. Did that actually happen?
Actually, we had the Salupa Hut come by, and at the end of the day, they drove up to us, and we bought some stuff from him. He said he did a good job. I think he was trying to call me last night. I tried to call him yesterday to confirm that he was joining us at GW. We think we're going to get at least two food trucks.
What did you say?
At GW in Manila tomorrow.
The Chalupa Hut? What was it?
Yes, Salupa Hut. I think that's what Mr. Uggan's hut food truck is called.
Okay.
They had
they have hot salupas,
candy, shaved ice, and they had acai bowls.
Oh, so it's healthy.
It's very healthy.
Okay. So, but it's not a party, right, Miss Maria?
No, it's not a party.
Okay.
It's come to vote, and the lines are shorter here at GEC than they are at Ross. So you don't have to wait long.
So what happened during the meeting last night?
I gave them an update on our status on in-office absentee voting. We talked about how to. They asked me to be more assertive and aggressive out there so we can get our numbers up, so we can get higher voter participation. Our numbers are going down now, so with your help, Sabrina and Chris, we want to get the voters to come out. Over here, we're open 9 o'clock to 6 o'clock, Monday through Friday. And then tomorrow we will be in Manila. We have 2 more satellite locations the next 2 Saturdays. But please make sure, if you're in Manila, come over and vote. I think the 2 candidates that came before me, they'll be there. So You'll have a chance to meet some of the candidates. We've been fielding a lot of calls from candidates asking us where they can be, and we let them know that they just have to be 100 feet away from the entrance gate.
Miss Maria, we had a comment here. What about those who can't go to GEC or the satellite voting places? In-home voting? Where are we with that?
So we started going out. This will be our third day of going out, and we've serviced already over 75 homebound voters. We want to make sure that that if you're the truly homebound, please make sure to call us. If you call us, we'll get the information on the voter, on the homebound voter himself or herself. We'll prep all the paperwork, and we will schedule to go to their houses. We started going out this week, and we will continue to go out up until Election Day. Just call us at 477-9791.
Maria, any other issues brought up during the meeting yesterday? Any reports or anything that are due by candidates that haven't been turned in? Any constituent complaints or anything filed?
October 19th, personal financial disclosures are due for those that had requested an extension. It was originally due April 22nd. Elected officials, public officials, directors, agency heads, if those that requested for an extension, their personal financial disclosure statement is due
on the 19th.
October 19th. Campaign finance reports, preliminary report for the general, I believe, is due October 23rd. And so those reports will come to us. That's for the candidates. They report their campaign finances, how much they spent, how much they received. That's due October 23rd.
But that's for the general. What about the primary? Everybody filed their documents that should have filed their documents?
Sabrina, unfortunately, these reports are due right in the midst of primary and general election preparation. We have an ongoing list, and if you remember, we have to receive them electronically because of the executive orders. So we're working on getting a list, finalizing and vetting our list so that we accurately report who filed and who did not file.
So it sounds like you got a list, that you got some names of people that didn't file.
But we want to vet it out, Sabrina, so that we report accurately. And my email is so full, we want to make sure we report correctly.
I got you. I
got you. We'll call Kenny Boo.
All right. Anything else, Maria?
No. We want to know when KUAM is coming down to vote.
We'll be down there Monday.
Okay.
I'm still a little mad about my primary election vote.
Chris, I myself witnessed, and I stayed there until the last envelope was destroyed. Thank you.
Right on.
All right. Thanks, Maria. We'll see you Monday.
Yeah, we'll see you Monday.
All right. Seduce Masi.
Hey, you still got my lemon chips?
Yes.
Okay. Thank you. Sorry.
More importantly.
Yeah, that's okay. Thank you, Miss Maria.
Algamas.
Okay, that's that. All right, let's keep it in the K-Wave News Zoom room. Well, let's go to Manila, the education capital of the island. And
Principal?
The principal, yes. No, I was checking. Principal Ishmael Perez, Father Duenas High School. And good morning, Principal.
Good morning, Chris. Good morning, Sabrina. Good morning, Jason.
Good morning.
We brought you on because I had heard that FD is the testing site for the SATs, and you guys have had some trouble actually getting the SATs conducted, right? And can we just start at the beginning? I know that there was supposed to be a test setting for May, right? But
That's right.
that was you guys kind of just canceled that one because we're COVIDing hard at that point, right?
Oh, yeah.
Yeah.
That's correct. So May and June are typically the times when outgoing juniors would take the test. And can you hear me okay with the mask on?
We hear you perfectly fine.
Okay. So May and June are typically the dates when outgoing juniors would take the test. And then over the summer, spend a little bit of time picking up their scores and then taking the test in the fall when they come back as seniors. And so now we're at that point. August, September, and now October are test options. And that's where we are. We're trying to get those to be administered for the island's youth. And, it's important to note this is not an FD only test site. This is a test site that serves the entire community. We get kids from all over the island, some off island too.
Right. Public school, private school, homeschool, all kinds of students. So, Principal, you had scheduled it in May. It was canceled, and then tell us about the subsequent makeup dates and what happened with those.
So the scheduled ones we have already from College Board are designated to be in August, September, and then October. And we have a makeup one, oddly enough, in October 10th. And they're asking if we can do that. The College Board is asking if we can do that so we can accommodate students who haven't had the opportunity to take it. In other places in the States, they might have a place they can drive an hour or 2 hours that's open to test. But here in Guam, we're very limited.
Right.
We only have 2 test sites, and we don't want kids having to fly to take a test when it can be offered here. So we've been asking for permission to try to get those opened, in a safe way that we can have all the students take the test in an appropriate and safe manner.
Right. So let's just get to that part of this conversation. So you guys have been in dialogue, if that's what you want to call letter writing. Well, you've been in conversation with public health, right? And so basically, you guys need public health's blessing, quote unquote, to be able to conduct these tests. But you have you told public health, like, hey, this is how we're going to do it. We're going to do social distancing. We're going to do this. We're going to do that. So I just want to have you guys done your part in showing public health that this is how we're going to conduct the tests, and we're going to make sure that we're adhering to the social distancing, to the mask, to all the COVID protocols.
Yeah, we've written letters to sort of get them to engage in the conversation. And we have protocols from when we were opening schools. So we have temperature check stations. We've got hand sanitizers, federal programs and Catholic schools office, and a lot of donations have come in with supplies for PPE. We have masks and so many hand sanitizers. We have 700 bottles, I think, just a round figure. But we have enough that every kid can get their own, set. And social distancing, it's interesting that we'd have to put a plan again together to show them that we're going to do masks and hand sanitizing and, social distancing. That seems to be the norm for every single operation,
right,
business, restaurant. So we just wanted to engage in a conversation and see how do we go forward to do this, because this is getting really time sensitive. This is application season, and our seniors, I don't know what next year will look like. This year is crazy because a lot of schools are online,
right,
and we just want to give them the opportunity. So these students that are applying who have borderline GPAs, could get into a school. That one SAT, even though it's test optional in a lot of places now, that might be the one piece that actually sets them over the bar to get accepted, and even maybe a scholarship that otherwise wouldn't have been available with the GPA they presented. So it's all about, providing the students an opportunity.
Of course. We shouldn't be in this position where we're trying to explain to the government how crucial our kids taking the SAT is. It's kind of a thing, right? So what does public health come back, and what has their response been to you guys? Did they say, oh yeah, that's important, go ahead. People can go get a tattoo. They can give their poodle dreadlocks, so they can get their nails done. So yeah, go ahead, Timo, go. Yeah, do the test. You got it.
No, the responses we've gotten have been very, we'll take it into consideration. And then the next one is it's not allowed in Peak War 1, which, I understand the pandemic and I share the sentiments of the government and the health officials. I would really like to maintain the safety and health of everybody. But the response we get is it's not allowed in Peak War 1, which I understand, and that's why we're writing is we want to make sure that we get the okay and even the guidance, if they want to help us to understand what we might do to make it a better experience. We're even willing to go to like 9 students a test room, which the college board, I'm sure they'll be open to it, but usually they want us to maximize the number of seats in a room. But in this situation, we're going to have to tell them, no, I'm sorry, but 9 people is the max we can test in one room with one proctor. So we're willing to make, concessions and even the guidance, you tell us what we need to do and we'll try to work with you. But from all the standpoints, it seems like we can cover, social distancing, hand sanitizing. We even have our own those electronic mist sprays. We have a couple of those that we've been using to sanitize our school from the time that it was, open. So it's not like we don't have protocols that we can follow.
Right. Yeah. And I think we're so far and deep into this pandemic that everybody kind of has the general idea of what you need to do when you have something, an event, whether, and the social distancing it requires. Let's talk about the human impact here.
Oh, yeah.
Principal.
That's a really big.
This is, to me, it's the biggest, this is the biggest issue here is we have our kids who, are trying to get that higher education. We always talk about education. I mean, obviously, the first couple go rounds, I get it. Like I said, we're COVIDing hard, probably not feasible in any way. But now, I mean, we're basically in Peak War 12.
Yeah, and we're trying to keep the spirits of the students up. We met with our kids on virtual assemblies, trying to make sure that they're in good spirits, they're engaging in classes. But it's really hard to, especially for teenagers and teenage boys who want to go outside and run and throw balls and, our football team hasn't done anything, and it's not that I'm asking for sports. Yeah. I completely understand. But the social aspect is huge. I get emails every day from parents and students saying, when is this going to end? We need to get back to class. I really can't learn this way. It's hard, and for, with all due respect to the health professionals and the government, there is a job, but at the same time, we really need to engage the education professionals and find out, what's it like and is it working? Because it's nice to say we can go online and learn and online classes are great. That's not for everyone. Yeah. It's really tough to do online classes. And, contrary to popular opinion, we don't have kids with great Wi-Fi and devices. And, some of our kids lack some of the things. So we are trying to accommodate them, but we can't even let them use the Wi-Fi at school. Right. Because they're not allowed on campus, which we were thinking they would let us.
What I meant kind of more was that kids are trying to go to college, and this SAT is a key part of that. And so what are you going to do? You're going to write, whether you're going to put a letter with your college application, be like, "Dear college, so sorry, but we weren't able to take the SAT because we basically were being ignored by public health and." The governor was opening tattoo shops and, all these other things. And so we were just stuck here and we didn't get an answer. So anyway, hope this is okay, right? Let me in.
Yeah. And a lot of schools are going test optional. That is true.
Right.
But I don't also want them to think that because it's test optional that they don't have to take it.
Because you want to do everything you can do, right? You want to be right. I mean, test optional. To me, if I'm applying to a school, I'm going to do the test because that's another way that can push me over the top. So that's what I mean when I say
tell them optional means opportunity. So if they say it's an optional question, take it as an opportunity to tell them more. A test optional, that means a test opportunity for you to give them one more piece that might help you. If it's a bad score, don't send it, but if you get some scores that are going to be better and help you get over the end, the finish line, then we need to give those kids that opportunity because we're already at a disadvantage. Being from over here.
Right. So where's the happy ending here? You have the makeup date is October. What'd you say, October 10th?
Well, we're supposed to have one tomorrow, and we haven't heard from that request. I know that they're under the impression that the first one they gave us about the September one should cover everything going forward. But given the lifting of restrictions that's at the stores and the mall. You can go to the mall and, like you said, tattoo and massage parlors and stuff. And if the restrictions are lifted, then there should be some consideration for things like this that are even. I don't have any physical contact with anyone. I pass out a book and a test answer sheet and collect it. It's very minimal contact. So we'd like to have that opportunity to engage in conversation and at least know some forward steps that we can take and allow the kids to take this test. We have lists that, we get lists of the registration, and we have to just tell them, I'm sorry, we're closed again. We're hoping, and we'd like to write to College Board and be like, we'd like to do every single Saturday for October and November and give everyone opportunity. If we need to lessen it, we can.
Right.
But the only guidance is no.
Is there a tattoo shop maybe that you can have the SAT test at?
I was making jokes with people and saying, if we just sell something in each classroom, maybe we can be considered retail.
Curbside SATs.
Yeah.
Adapt and survive.
At this point, all we could do is just laugh it off.
I mean, yeah,
and,
really,
like,
just a lot of laughing it off this morning. Yeah.
But it's no laughing matter.
It isn't. I mean, yeah, it's very serious. So, I mean, we put you out here. Public health listening. The governor may be listening. What would your message to them be?
My message is try to engage the educational professionals. I know they talk to DOB, maybe sometimes they talk to our superintendent of Catholic schools, but just engaging a bunch more people, we might be able to come up with some solutions on how to address the needs of our students in this very trying time. It's still stressful for everybody. It's they expect us to jump on and just be like, yeah, you can do online stuff. But really, it's more than that. We're a community at school. And we don't have that. So I think getting a group together, a committee to help think this through. I'm not talking about opening next week or anything, but in the end, when we do open, we need a plan and we all need to be on the same page, but we don't seem to be getting that engagement at all.
Yeah.
And we'd like that.
And I mean, you're not even asking about opening the school. You're just saying, hey, let us do this SAT thing. It's a one and done kind of deal. I mean, I'm pretty sure environmental health or whoever can go in and look at the floor plan and make. And there's just too many broad stroke decisions being made when I think that more of our decisions should have a laser focus on a case by case basis, right?
That's correct. That's exactly it. We need to work together and these we even have contact tracing abilities because all the kids have contacts that we have to we have to have their name. We don't just let anybody walk in.
Right.
Like the stores, we know everyone who's coming in.
Well, we put it out there, and just keep us posted. You got my number. Let me know if Public Health gets a hold of you today.
Thank you so much. We appreciate the coverage and the ability to let the public know that we're trying. Because I know that students are wondering, and I can't keep telling everybody, but this is the best way to get out on the media and let them know that we are trying. We are trying to get everyone in to take the test. So hopefully something does happen. I appreciate the time, though.
Okay. You sure you don't want to get mad here right at the end? Pound the table a little bit?
No, I'll do that off the air.
Okay.
Thanks, Principal
See you,
Ferris.
sir.
Thank you very much.
Okay.
Stay safe.
9:44.
Instigator.
We're going to take a short break, and we're going to come back. I want to bring Chloe on. This is a really sad story. During this PCOR 1 lockdown, we've had the AG on. They've made a big deal about, nobody can be evicted during the PCOR 1.
We've had GPA on, too.
Yeah.
No disconnections.
Correct. So we'll get to the bottom of this because it kind of looks like she's had both of these things.
And she's got children.
And she's got kids. So keep it right here. It's The Link on the Breeze. 93.9, good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Pepsi Guam Bottling, a local company. We produce your favorite products right here on island, like Pepsi, Mountain Dew, Hanum, Chamorro Punch, Tropical Ice, and more. We've invested millions into local production and will continue to upgrade our facilities and provide local jobs so you can truly buy local. Our long history of producing the freshest and best products will continue. This is our vision. Pepsi Guam Bottling.
Your generosity can change lives. Disasters won't stop during this global pandemic, so neither will we. The Guam chapter of the American Red Cross is calling on the continued support of the community to assist with their mission of providing disaster relief and recovery efforts, military family support, and life-saving training and certifications. In times of emergency, our support will not waver, and we pray that your support of our efforts will continue as well. We invite you to join us in commemorating our 20th annual signature fundraiser virtually this year by supporting the Red Ball in a Box. We will be delivering special red boxes, which include a 4-course dinner from Micronesian Chefs Association and wine to our patrons and sponsors. As a sponsor, your company and message will also be featured in a special television tribute to the Guam chapter of the American Red Cross. For sponsorship opportunities and more information, please call 688-0280 or visit our Instagram or Facebook page. Let's support our community. Though we're apart, we're still together in generosity and support.
$9:48. The Link, The Breeze, 93.9, brought to you by Carrier, Cabo Enterprises, IT&E, and the Thrive Coalition, where we're going to give you a sneak peek of the new One Micronesia podcast next. But we'll go to the KUAM News Zoom room. We're standing by. We have Chloe Sanchez, and thank you for joining us. First of all, good morning, Chloe.
Hi, Chloe.
Hi, Chloe.
Yeah, she said she's on quarantine hotel Wi-Fi, which may be...
Wow.
She's in quarantine?
Okay, we got. It looks a little stuck here, so we're gonna move to the.
There she
there.
is.
Hi,
Okay.
Chloe.
Hi.
Hey, are you in quarantine?
No, I'm
Okay.
actually just staying at a hotel.
Okay, and so Chloe actually reached out to us. We were tagged on Facebook. She's going through a lot right now. It's just really heartbreaking, Chloe. If you want to go ahead and share what you're going through, which is a lot.
Just even thinking about it right now makes me want to break down. My landlord has cut off my power, not once, but twice. And for the second time, it's much harder because the first time that our power was cut off, we were able to turn it on ourselves because the meter was switched off. And for this second time, we are unable to turn it on without her help but she's been ignoring me and my other half since the month of July. And a couple of days ago, actually a day ago, we found out that she blocked our numbers. And we have no idea where she stays, don't know how to get in contact with her. And the people that we can get in contact with to try and find her are not answering my calls. So the day that we found out that my power was cut off, me and my 3-month-old baby, we slept in our car with my other half as well. And my 2 other kids were at their auntie's house.
So we lost your audio, Chloe. Are you there? Are you there? So again, this is Chloe Sanchez. She stays in, I want to say, in an apartment. Is that correct, Chloe?
So from there, I guess we're just going to have to ride it out, I guess, till we can get the help.
We lost you there, Chloe, for a little bit. So do you stay in an apartment? And you were evicted?
No, I actually stay in a house.
Mm-hmm.
And it seems like an eviction.
And so you had reached out to the Attorney General's office, the Consumer Protection Division, correct? I saw that on your Facebook post. What type of response, if any, did you receive from the AG's office?
All they did was refer me to an attorney, but the attorney told me that he does not represent me, and he can't really do much because he doesn't represent me. And he referred me to the Guam Bar Association, where they referred me to about 17 different attorneys and lawyers, which all of them, which I called, all 17 of them, they told me that they can't take my case or they can't take my case or they don't deal with my type of cases.
17 lawyers told you no?
Yep.
And so this is kind of one of the ways that because they're not supposed to be evicting people during the PCOR 1 lockdown, but obviously this seems like one of the ways that landlords get around that, right? And so you couldn't pay your rent because you lost your job? We got a comment. Lawyers are sharks. I was going to say. Chloe, we're having really bad connection issues. Yeah, she just froze, Bree.
Oh.
We lost
Okay,
her.
well, we lost. Wait.
Sorry.
No problem. So the AG's office referred you to a bunch of lawyers. 17 different lawyers said, nah, not doing that kind of thing for free. And like I said, it kind of seems like this is how they're getting around the eviction. So what remedy is there for you? As you're staying in a hotel. Okay, we just can't. Sorry, Chloe. I'll reach out to you offline after the show, and maybe we could do something when the connection is better, or we'll try it again, I guess. Chloe, yeah?
Okay.
Okay, we have you now. So what's the remedy for you? You're staying in a hotel, homeless now?
Pretty much. No power and water. I'm not too sure. I actually don't know what to do.
Okay. Well, you know what we're going to do is we're going to put you, I got your number, Chloe. We're going to put you in touch with some people who, there's a lot of different, there's a few.
Gora.
There's Gora. There's different entities and organizations that can provide emergency shelter. I think
Catholic
especially,
Social Services.
right. So we're going to get your number out there to those people. 956 Got to move along now here on the link. It's the Breeze 93.9. Brought to you in part by the Thrive Coalition, where it takes a village to raise healthy and drug-free youth. And we're going to give you a little snippet, if you will, Bree. There's a new episode drop of One Micronesia podcast.
Yeah, that's with Vic Fallon. It's going to be dropping tonight at 6:30 on KUAM TV8. And this is something that we do, again, in partnership with Thrive Coalition and also Manyetlu.
And so here you go. It's a little sneak peek of the One Micronesia podcast, new episode drop.
All right, Hafidi guys, and welcome. All right, Hafidi guys, and welcome to another edition of the One Micronesia podcast. Like I said, this next couple of episodes, we're going to be talking to awesome individuals, awesome organizations, groups who have really stepped up and helped with the Micronesian community here on Guam and elsewhere, and also bringing together this message of unity. And of course, with us today on the show, we have the one and only Jackie Marati from the Bank of Guam with us. Jackie, for those who don't know, tell us your position and what you do for the Bank of Guam.
I'm in charge of communications and probably most importantly, corporate social responsibility with the bank.
Why do you think diversity is important?
Diversity is richness. Diversity is richness of experience, of perspective, of values, of culture. Diversity is such a needed value and to our lives. I think that with diversity comes a greater understanding, not only of people's beliefs, but also, of spirituality. There is that need to see the differences in people that actually kind of boomerangs back to us, and we see our own differences. And so diversity has been key to the Bank of Guam's development in the communities. We have, as I mentioned earlier, we have branches in nearly all of Micronesia. And we're very proud of not only the people that we've trained, but also the leaders that we've developed and trained out there. And so, our goal is to bring that kind of confidence and that kind of value to the islands that they can in turn continue to grow within.
So, Jay?
Tonight at 6:30 on KUAM TV8.
Yeah, if you were interested in that very, very fascinating conversation with Jackie Marati about corporate citizenship, about community service, about giving back, and
diversity.
And what Vic has really been focusing on, for the last few weeks is the concept of unity and doing that. So yeah, if you want to watch it, it's on YouTube right now. It's going to be on TV8 tonight, 6:30, and it's going to be on Facebook Live tomorrow, 10 a.m. on our Facebook page. So we spread it out. Want to make sure everybody can see it because it's really good stuff. It's a positive message.
Thank you, Jay. We now move ahead in the show here where we're going to tell you about some really cool food that we got.
Yeah. It's part of our curbside to crib segment.
Right. And so this morning we're going to tell you how you can get some great meals to go at Payless Supermarket. So these are available at Magila, Oka, Sinanya, Sumai, Micronesia Mall, and Jigo. They're meals. We've got some meals here from California Pizza Kitchen, Beach and Shrimp.
Right. So if you go to Payless, you may notice that, you actually can pick up food from these different restaurants, like Chris said, CPK, Beach and Shrimp, Pika's Cafe.
Right.
And all you got to do is drive in and pick out what you want. And so some of the things that we have here, we have sandwiches from
Pika's. The sandwiches
Cafe.
are from Pika's. They got the Pika ham and cheese, the deluxe. It's the deluxe, which is a roast beef with horseradish crema, upper tumon. That's a turkey avocado pesto provolone. And they have the Gulf Mungi, which is a tuna Sammy. And then CPK side, man, I'm not much of a salad guy unless it's like potato salad or egg salad or tuna salad or crab salad. But the Thai Crunch salad with shrimp.
It looks so good.
Can we please describe? Oh man, this is insane.
I've always been a fan though of the Thai Crunch salad.
Yeah, it's good stuff.
Yeah.
They've also got the original chopped salad, classic Caesar salad, quinoa and spinach salad, miso shrimp salad, and again, These are only available at Manila, Oka, Sinanya, Sumay, Micro Mall, and Jigo Paylesses.
And we also have from Beach and Shrimp. I'll go ahead and open that up so everybody can get a good look at it. They have the Do the Hokey Pokey Bowl. So you have your fresh pokey and all the vegetables in it. And this, again, is from Beach and Shrimp. And as Chris said, these are at Payless Supermarkets. This one's they're only offered at Manila, Oka, Sinahanya, Sumay, Jigo, and the Micronesia Mall.
Right on. So if you're looking for a quick and good bite to eat, you can swing by those Payless locations. Also, Beach and Shrimp's offering the Hokey Pokey Bowl like we got there. And they've also got this Shrimply, you get it? Shrimply Delicious Beach and Kelligwin, which is basically a shrimp Kelligwin wrap. So we definitely want to thank CPK, Picas, and Beach and Shrimp here. Again, these are available only at Manila, Oka, Sinanya, Sumay, Micro Mall, and Jigo Paylesses. All right. Hey, guys, lunch is on me.
Thanks, Chris.
Hey, you got it. Good job today, Bree.
Good job.
You want to go over the stuff to go over real quick before we go? Or?
Yes.
Okay.
This is important. I know we kind of joke about it sometimes, but this is the real deal. We are still in PCOR 1. I think earlier this week we announced that the governor extended her public health state of emergency until October 30th. The Safer at Home is still in place, but late last night we got the latest and newest executive order that was signed by the governor, and starting this weekend, more businesses will be allowed to reopen under Guam's current PCOR 1 designation, according to the new executive order, again signed late last night, effective tomorrow at 8 o'clock in the morning. Social gatherings and congregations of no more than 5 people will be allowed. Religious services can resume, but at 25% occupancy. All GovGuam parks, beaches, and pools will reopen, but limited to 5 people per group. Gyms, fitness centers, and dance studios are allowed to reopen, but at no more than 25% capacity. On Monday, October 5th, eligible child care centers will be allowed to reopen, and sports organizations may request authorization to conduct non-contact training at their designated training facilities. As for the latest numbers, out of 434 samples that were ran through various labs, 62 returned positive, bringing Guam's total COVID case count to 2,550. There are 635 individuals in isolation, and more than 1,800 have recovered. Again, we've seen 49 deaths as of today. At least 27 hospitalizations at the Guam Memorial Hospital, with 10 people receiving ICU level of care. And the latest numbers will come out by the JIC, more than likely sometime tonight.
Right, and another takeaway is we had the Department of Public Health and Social Services on territorial epidemiologist Dr. Ann Pabutsky saying basically it's the governor's call. But that the numbers are still high. We're not out of this surge yet. Every frontline person that we talk about, subject matter expert that deals specifically with the virus from a purely medical and scientific standpoint, they're all on the same page and saying that it's still very dangerous, and we just got to be safe. And for all intents and purposes, they don't agree that we're flipping everything open. I think one of the things they had mentioned was monitoring of the easing of restrictions that we did the first time, and now we're adding on to that by opening more. So it really, guys, it's on us. It's safer at home, but it's funner on the road. So mask up. Social distance. Again, it is confusing when you're presented with all these things that you could do, but they're saying, but the people who are in charge of taking care of you when you get sick from this virus are saying, no, stay home.
Right.
Okay.
And we're also hearing there probably more than likely will not be a press conference today. That's the word we got from Jason, who's been in communication with Crystal Pacos and Augustine, that they're not tracking a press conference for today. So what we just told you is pretty much
what it is. Okay. Yeah.
Sorry, guys.
Sorry. I mean, I don't know why we're sorry. You know, that's your governor. She should make herself available to answer these questions and concerns.
We want to make sure everybody gets, all the information possible. And
yeah.
It is what it is.
And we're going to do our part to get, people on who we can ask these questions to and provide us with the answers, right?
Yeah. So we are still in P Core 1. I know earlier I was joking. It was P Core 1 point fun. But yeah, we're still in P Core 1. And, wear your mask, practice social distancing if you're going to go out and about. And just be careful. Please be careful.
Right. Another thing Dr. Babutsky said is we're doing worse than Hawaii right now. Okay, so just keep that in mind. 10:06 for Joe, sir. Jason Salas, Master Control, Kengineer. Also, we got your 6 with our primetime KUAM News broadcast. My name is Chris.
I'm Sabrina.
Thank you, guys. We'll leave you with a little Inetno Gef Pongo at the end of the day at 10:06. Thank you so much, Link fam. Esta. Adios.
Bye.